Kevin to hold down ask, don't tell. It's out the window anyway.
Okay, keep quiet.
Hi, I'm Dr. Judy St. Ledger. I'm the veterinary pathologist for SeaWorld and Busch Gardens, and I'd like to talk to you today about the gross pathology and findings of disease in marine mammals. Now, a talk like this really is a talk that's made up with contributions from a number of different folks all across the world. I'd like to take a look at the first slide so we can acknowledge some of the contributors to this presentation. Lots of folks from many different facilities, both clinicians and pathologists, have contributed to the talk, and without their help and assistance, I really couldn't have put this together to present it to you today. What I'd like to do is to really focus on two important concepts when we look at marine mammal pathology. There are certainly species-specific lesions and conditions that you need to know, but more importantly, for pathologists that have experience with terrestrial animals, there are a number of common lesions that you're going to see that you know in terrestrial animals that can be seen in marine mammals. So we'll take a look at diseases of marine mammals from both of those perspectives. Now, we all need to start sort of on the same page. So what I'd like to do is to just make sure that when I talk about marine animals, marine mammals in particular, you sort of have a sense for what we're talking about. So there are two important groups of marine mammals that I need you to understand a little bit about just to start with. The first are the pinnipeds. And pinnipeds consist of seals, sea lions, and walruses. These are coastal species, and they have some important anatomic features that really are important when you're doing necropsies on them. They have a large hepatic venous sinus. So the first time I saw this structure, I thought, dear God, I have an aneurysm in this animal. But it's a normal diving adaptation in these animals. Other diving adaptations that are important just to recognize when doing gross exams are things like a large distensible spleen and a collapsible rib cage. Because they have such an important oxygen requirement while diving, they have very dark musculature. And again, these are normal findings in these species. Now, cetaceans consist of porpoises, dolphins, and whales. So this includes everything from odontocete, or the toothed whales, like the dolphin shown here, to mysticetes, or the baleen whales. In the lower right-hand corner, we have a picture of a young gray whale, and you can appreciate the baleen as the animal opens its mouth. It's also important to remember that cetaceans are both marine and freshwater, and there are freshwater dolphins. Because we have different pathogens present in these different environments, we can see different diseases in the two kinds of cetacean species. For everyone that says right now, well, I've never done anything where I've seen the insides of an animal this unique, here's sort of a picture of a dolphin on the half shell. And you can really appreciate in this guy that towards the left-hand side in the thoracic cavity, the lung is clearly visible. Just caudal to that, you see the liver, and above that, the stomach. Just caudal to the stomach, you can see the multireniculate kidney. The multireniculate kidney is important in many cetacean species, and then you can see the intestines. The upper respiratory tract is important in cetacean species because it does have some important features that really are significant as it relates to pathogenesis of disease. At the top of this head on the half shell, you can see we've got the blowhole, and it's extending down to the upper respiratory tract. These animals have no nasal filter to sort of keep pathogens out, and that's important because respiratory infections are very common in these species. Of note is that they do have cartilaginous rings that extend down to the level of the bronchioles. And this is simply important because when you're doing examinations, feeling small firm areas in the lungs when associated with the airways is a normal finding in these species. Another common finding in these species is the presence of accessory spleens. Here you can see the spleen of a rough-toothed dolphin, and surrounding it are a number of multiple accessory spleens. These are a common finding in this species and a number of different cetacean species, and it's simply something you'll see. What I'd like to do now is to approach diseases in these species sort of looking at the different classes of diseases. And I'd like to start with bacterial diseases simply because these are a common and significant component of the diseases of marine mammal species. I'd like to start with a disease that you know, but with a presentation that's unusual in many marine mammal species. This is a shot of removing abdominal fluid, a clear abdominal fluid from Tursiops truncatus per acute mortality. In this case, the animal was noted to be fine in the morning and then dead in the afternoon. And the reason for development of ascites is this is an illustration of per acute erysipelathrix bruceipathii infection in a dolphin. Now, erysipelas in these animals is different than the erysipelas you might know about in pigs or in turkeys. We have a very significant component of the disease associated with per acute mortality. These animals have a septicemic incident, and it's very common to have both thoracic and abdominal effusions in those cases. Now, in the second disease form, it's much more closely related to the condition that you may recognize in pigs. Here we have a shot of the back of a beluga whale, and I think you can easily appreciate the rhomboid changes in the skin of this animal. In the dermal form, we have, very similar to the pig lesion, areas of vascular thrombosis with rhomboid cutaneous necrosis and infarction. This disease is transmitted via ingestion of fish and exposure either via the GI tract through stomach ulcerations or by animals raking each other. And a rake is sort of a marine mammal's, a marine mammal's way of saying, hey, what the heck are you doing? If you look on the back of this beluga whale, you can see the parallel linear marks of the animal. We know that erysipelathrix bruceipathii is a common component in the slime of the fish that we feed these animals. When feeding an animal, if they get that slime in their oral cavity and then rake other animals, and this is more common in the Tursiops where we see this condition, they certainly can transmit the infection via the aggressive or sort of social interactions from one animal to another. What's nice about the chronic infection is it does respond to antibiotic treatment, and here's a picture of that same lesion over time. You can still appreciate the central area of darkening of the skin, but in general the healing really is very impressive in this animal. I'd like to move from erysipelathrix onto another very significant bacterial infection in these animals, and what we're looking at here is the ventral side of the brain of a common dolphin. You don't have to use too much imagination to appreciate that just to the left in the meninges you can see extra glistening, there's increased edema and opacity to the meningeal surface. And the reason for that is we have a pretty significant non-suppurative meningoencephalitis with associated edema. If we take a look at some of the sequela to that expanded meninges and meningeal inflammation, these are shots of hydrocephalus secondary to that condition. And what you see here is a marked expansion of the ventricular system within the brain. It's important because these changes are associated with marine mammal brucellosis. Brucellosis is a significant condition in both cetaceans and pinnipeds. I'd like to focus on cetaceans today. And what we see in many cetacean species, again, is a marked non-suppurative meningoencephalitis. There are at least 2 different species of Brucella associated with marine mammals. Right now, they're sort of lumped into Brucella cetacea and Brucella pinnipedia. However, the full classification and speciation of Brucella is still under development, and we'll know more about that in 3 to 4 years. Besides the hydrocephalus lesions, we also have development of abortion, similar again to what you see in terrestrial animals. We do have vaginitis in these animals. This is another sample from a common dolphin, and you can appreciate the vaginal and uterine body mucus plug in this animal. This animal, in addition to meningoencephalitis, had a granulomatous vaginitis and metritis, again associated with the Brucella infection. Lastly, with brucellosis, here we're looking at the back side of the skull of an animal. And what we see here is marked irregularity as well as thickening of the atlanto-occipital joint. Well, atlanto-occipital osteoarthritis has been associated with marine mammal brucellosis. Atlanto-occipital osteoarthritis is not an uncommon finding in many stranded dolphins. If we look here at the clean skull from a stranded bottlenose dolphin from the east coast of the US, if we look at the first cervical vertebra, you can see that it's adhered to the back section of the skull. Now, you may not be used to seeing the skulls of dolphins. However, if we take a look at the ventral side of this, I think you can easily appreciate the marked remodeling of both the ventral surface of the skull as well as the ventral surface of the first cervical vertebra. There are likely a number of different conditions that can cause this kind of change. Certainly, this could be a primary degenerative osteoarthritis. This could be secondary to a different kind of bacterial infection. But one of the rule-outs for this condition remains marine mammal brucellosis, and that needs to be considered and examined for when you see this sort of gross change. Moving on, let's take a look of a kidney from a California sea lion. And looking at this kidney, you can see that the interstitium is expanded by a diffuse white infiltrate. What we're looking at here is the gross presentation of leptospirosis in sea lions. To make things easier to appreciate, it's important to remember that this multireniculate kidney certainly should have small, obvious raniculi, but that the expansion of the white interstitial material is what we're looking for when we have leptospirosis. This condition, this is the chronic presentation of this condition. Just like with leptospirosis, say in dogs, we can have an acute condition where we have a necrotizing hepatitis and significant acute mortality. But this more chronic presentation is a common finding in adult sea lions, in particular the adult males. We do think that this is sort of an endemic condition in the populations, and we do see rises and falls in the incidence of this infection in sea lions that are stranded. We're shifting gears again, and what we're looking at here is another tissue from a pinniped. This is a Mycobacterium pinnipedii, granulomatous pneumonia, from an animal from New Zealand. These pictures came to me from Dr. Wendy Rowe down at Massey University, and this is a very significant condition in Australian sea lions, New Zealand fur seals, and animals of the southern hemisphere. These animals present in a very emaciated clinical condition. On gross examination, they have a marked lymphadenopathy, and here's a shot of one of the lymph nodes. You can see it's enlarged, it's irregular. There's marked destruction of the normal architecture and expansion with a granulomatous inflammatory response. The granulomas are commonly seen in the lungs, but they can be seen in a variety of viscera, and certainly impaction on the lymph nodes is important in this species. Mycobacterium pinnipedii is closely related to M. bovis. This has been a concern in zoological collections in Europe, and improving the diagnostics, specifically clinical diagnostics, for this condition remains an important concern so that we can better evaluate the zoological populations of animals from the southern hemisphere. Now, sticking with Mycobacterium, but moving away from the tuberculous Mycobacterium infections to non-tuberculous Mycobacterium infections, here we have a section of lungs that were taken from a beluga whale. And if you look at the pulmonary parenchyma here, you can really appreciate that there's a mix of firm pneumonia lung with intervening areas of congestion and edema. This is a Mycobacterium abscessus infection from a beluga whale, and Mycobacterium abscessus is one of the atypical mycobacteria that can cause a variety of different conditions that we see specifically in pinnipeds, but you can see these issues in both pinnipeds, specifically in cetaceans, but you can see these conditions in both cetaceans and pinnipeds. There are a variety of different presentations of these infections, and they vary from changes like the pneumonia we see here to a dermatitis and cellulitis. Recently there was a report of a case of mastitis with extension to cellulitis in a beluga whale. There are a variety of cetacean species that are impacted. Those include bottlenose dolphins, Tursiops truncatus, beluga whales, and pseudorcas. So you can see that this is not a particular infection of any particular cetacean species, but it is one to know because certainly you don't have the defined tubercles, but when you see a granulomatous response in the lungs of these animals, you need to think about the possibility of something like an atypical mycobacterial infection. Certainly if you stick an acid-fast stain on the slides from this lung tissue, you see abundant acid-fast organisms. This is a section from the animal that had cellulitis, and you can appreciate here that although we don't have defined tubercles, we do have distinct areas of granulomatous myositis, which are extensions from the area of cellulitis. Here we have a section of intestine from a dolphin, and you can appreciate that we've got a marked hemorrhagic enteritis. If we were looking at a cow, you'd say, hey, I think we've got a Clostridial infection, and that's the same case here in this dolphin. This is secondary to antibiotic administration. We have a significant hemorrhagic enteritis, which was fatal in this animal's case. Again, it's a kind of lesion you know in a species you don't, but it certainly can lead you down the correct diagnostic path to developing your rule-out list for this kind of change. This is a picture that warms the cockles of my heart. This is the lung. These pictures were taken by Dr. Stefan Lehr, and these are it's the liver from a hooded seal. This is nocardiosis. Nocardia asteroides has been identified in a number of hooded seals, and I actually think that this disease is one we need to focus on for diagnostics because it's a difficult disease to diagnose. Certainly, you see diffuse pyogranulomatous inflammation throughout a number of different visceral organs. Here we've got a picture of the hepatitis, but you can also see a necrotizing cellulitis, and to be honest, in the cases I'm familiar with, that is one of the most common associated findings. You can have pneumonia, you can have osteomyelitis. Essentially, if it can become inflamed, it will with these infections. And what's important is when you do acid-fast stainings for these nocardia, because they are variably acid-fast, you may or may not be able to illustrate the organisms. So it really takes a dedication to getting good bacterial cultures. You can see the section in the middle of the liver here where they got a clean bacterial culture, and it really assisted in diagnosing this case. But certainly it's a kind of thing where we want to focus on looking for what is the agent of this inflammatory response to improve diagnoses. Just for comparison, these are the bones from a killer whale, and you can appreciate here at the 12th thoracic vertebra that we have marked remodeling, and this is a focally extensive to diffuse granulomatous vertebral osteomyelitis. Again, you can appreciate that this was not the only lesion that was present in this animal, but that this certainly clinically impacted the animal because of the discomfort associated with this inflammatory reaction. There are a number of conditions of marine mammals that are essentially not seen in the United States but are no less significant. And certainly another highly significant bacterial infection of both cetaceans and pinnipeds is represented here in this picture. What we're looking at is a multifocal necrotizing splenitis, and I think you can appreciate that the hand is holding up the small spleen of a cetacean, and that within the splenic parenchyma you have multiple areas of abscessation and small white foci. What you're seeing here is melioidosis. This is an infection with Burkholderia pseudomallei, and this infection is generally seen in places like Hong Kong and Asia, and it's associated with the typhoon season. If we move from the splenic lesion, you can see that we have those microabscesses, as I said, in multiple organs. Here we're looking at lung. The scalpel is pointing to another area where we have significant parenchymal consolidation, and again, small abscesses within the pulmonary parenchyma. Lastly, remember that liver with nocardiosis and the small white foci throughout the parenchyma? I'm hoping you can appreciate that these hepatic microabscesses look very similar, and so it's important really to go beyond just doing the gross evaluations to getting the final diagnosis in these cases. Let's move away from those small white foci everywhere, and actually let's shift to white skin. This is a section of skin from a beluga whale, and this is a beluga whale's presentation of dermatophilosis. This is skin from a paper that describes 6 belugas in the St. Lawrence estuary, and in these animals they were noted to have small foci of gray skin that was slightly depressed, and all of these areas seem to have a central linear laceration or fissure. When they looked at these areas histologically, there was epidermal spongiosis, vacuolar degeneration, and within the epidermal changes, there were organisms that were really dermatophilus-like or morphologically similar to Dermatophilus. Now, Why is this an interesting or significant lesion? Well, it's not that it's histologically that similar to dermatophilosis that you know, say, in dogs or horses, but it is interesting in that this is very similar to the lesion that we see in crocodiles. Yes, a crocodile is not a domestic species that you would see every day, but it's interesting to note that we have the same sort of cutaneous change in a beluga whale as we do a crocodile. Now, we can get dermatophilosis in marine species. Animals like polar bears and sea lions have had reported infections, and in those cases, the changes we see are much more characteristic of the terrestrial infections that you know. I'd like to go through a series now of just sort of general staph and strep type infections. And again, the point of taking a look at these is to demonstrate that you know the diagnosis, even if you don't necessarily know the organism, and you have to take what you see and go one step further to identify the organisms involved. Here the gross diagnosis is a pyothorax, and it's easy to appreciate that we have lungs floating in a sea of purulent material. And it's no big stretch to realize that this animal was having a heck of a time breathing for two reasons. One, he was breathing against the pressure of all the fluid in his chest. And two, I think you can appreciate that really the cranial 2/3 has a marked cranial ventral consolidation, congestion, and pneumonia. This is a strep species pneumonia with an abscess that likely ruptured and caused secondary pyothorax. What's important is a variety of strep species are associated with abscess formations, metritis, dermatitis, mixed infections, and we can get all the spectrum of lesions that you would see and that you know in terrestrial animals. Here we've got a fibrinous pleuritis, again associated with Streptococcus species. These infections are often nonspecific and commonly secondary to other associated insults. It's not uncommon to see these sorts of pneumonia associated with lungworm infections. Oftentimes a primary viral infection is suspected, and you can imagine how difficult they are to finally confirm. But I think this is a wonderful example of, you can really imagine the lung sort of moving against the pleural surface and forming these tags of fibrin in this fibrinous pleuritis. To show the extent of it, if we cut down in that fibrin, you can see that as you move into the lung parenchyma, the purulent debris and abscess formation really extends below the pleura into the pulmonary parenchyma. Now, just so you don't get the sense that every marine mammal pneumonia is this big, horrid, purulent mess, this is not an uncommon presentation of a much milder bronchopneumonia. Again, you can sort of see that we have a multifocal distribution here, but looking at this lung, you can appreciate that all you have sort of on the surface of the lung to go by is an area of congestion. When you feel this area, it might be somewhat firm, and that should get you thinking, hey, I should be looking for pneumonia in this animal, both within the affected area as well as looking in the airways in the less affected areas for possible changes that might be associated with a viral infection. Let's get away from lungs, but stay with our staphs and streps. When you take a look at this picture, although you may say, I have no idea what this is a picture of, if I tell you it's tissue from a cetacean, you should be able to make this diagnosis. There are not very many tissues from cetaceans that are homogeneous pink surfaces. What you're looking at here is a focal abscess in a homogeneous pink surface. And I only know of one pink cetacean that's important to know about, and those are the pink dolphins, the Amazon river dolphin, the Inia species. This is a fantastic lesion because of its terrific name. This is golf ball disease. Golf ball disease is a strep Inia infection within the skin or subcutaneous tissues in Amazon river dolphin or pink dolphin. Now, if we back out a little bit and take a look at this lesion after it's been lanced and the purulent debris has been removed, here you can appreciate what we were looking at was a close-up of the flipper of the animal, and this was an area of local dermatitis extending to cellulitis in an Amazon river dolphin. This pathogen is generally associated with diseases in fishes. Certainly, when we talk about fish infections associated with strep Inia, things like meningoencephalitis in tilapia and trout are important, and it can cause a similar type lesion to the dolphin lesion, but more severe. You can get a really significant necrotizing myositis in red drum fishes. In these dolphins, they do tend to respond well to cleaning up, draining the areas, and being put on parenteral antibiotic medication. This is a zoonotic infection, and so it is a good one to know about, specifically because when it's a disease that's really been associated with pink dolphins, it's just a cool one to know. I wouldn't be helping you out if we didn't take at least a couple seconds and talk about pneumonia, pleuritis, pyothorax in manatees. It's harder to look at a manatee lung and pleural space simply because of the nature of the elongate lung contained within the pleura along the backbone in a manatee. Manatee lungs look as though someone took two French baguettes and put them up just below the backbone of a manatee. What we're looking at here is actually the open pleura of a manatee with a pyothorax. You can easily understand that this is very similar to the pyothorax that we saw in the previous sea lion case. However, what you see is that the space of the pleura is a different orientation than what you're typically used to. If we take a look at the lungs of this animal, you can more easily appreciate the collapsed lung that was unable to expand against the pressure of all the fluid in the pleural cavity. On the lower part of the screen, you're looking at a more normal lung tissue, and you can see that the pleura is clean here. Because we have significant separation of the two lungs, it's much easier to understand that we can have very severe disease in one side and much milder or even insignificant disease in the other side of the thoracic cavity of these animals. Now, you may think, wow, that's a cool slide, but how often does that happen? Well, it's not an uncommon finding. Unfortunately, manatees are commonly impacted by boat strike, and when they're struck by boats, a common site of impact is along their dorsal surface. Remember, they keep their lungs along 2/3 to 3/4 of their body at the dorsal surface. So impaction with secondary pneumonia, pleuritis, or pyothorax is not an uncommon condition in stranded and injured manatees. Just to sort of finish up with non-specific staph and strep infections, again, finding things like cerebral abscesses, not uncommon in these guys. Here we've got a beautiful section. This was a slide that was given to me by Dr. Richard Evans, and what you see is markedly expanded kidneys with a staphylococcal pyelonephritis. The gross for this would be a bilateral multifocal necrotizing. When you look at the histo, it's a tubulo-interstitial nephritis with pronounced abscess formation. What's important about this is if you saw, again, in a terrestrial animal, kidneys that were multifocally enlarged with purulent abscesses, you'd be thinking something like a bacterial infection. The same in this case here. I've got these lungs in here not because they're very typical of any specific condition, but just to remind folks that when they're thinking about marine mammal pathology, that when we get bacterial infections, we oftentimes need to really think about the possibility of pre-existing viral conditions. Here we've got a much more diffuse staphylococcal pneumonia, but in this case, the bacteria came in as secondary invaders to what was likely a pre-existing viral pneumonia. And if we focus simply on collecting samples from the areas where the most bacterial pneumonia is, we'll oftentimes miss the viral pneumonia. If we take and we cut this lung in cross-section, you can see that in the areas where things are very consolidated and there's a tremendous inflammatory response, you're not going to see a lot of normal tissue there. But if we make sure that our sections contain airways and sections a little bit further away from the pneumonic sections of lungs, that's where we're more likely to see the changes that may suggest viral infection. And this is in here. I think you could probably take a look at this and say, don't know too much of things, but certainly that smooth surface tells you that we've got a skin lesion. And this is actually the umbilicus of a young fin whale. And I think you can appreciate the irregularity, the mottling and congestion here at the base of this. This is an omphalitis. And actually there was spread from the omphalitis to visceral tissues. And here we have a bacterial abscess within the myocardium of this very young fin whale extending from the umbilical infection. I'd like to finally give you a break and step away from bacterial infections. Bacterial infections in my world are certainly the bread and butter of concern in marine mammal disease, but they are not the only agents of concern. Let's take a look now at some fungal diseases that certainly are important in marine mammals. We'll start out with one that is of certain interest, but has some features that make it important to marine mammals. And this is lachesiosis. This is an infection with Lachesia loboi. The condition used to be called Lobo's disease. It's now called lachesiosis. And it's a pyogranulomatous dermatitis. Commonly in these cases, we'll see a presentation like this. And what we have is the pyogranulomatous dermatitis here, associated with both the maxilla, the cranial mandible, this is the area we call the beak of the dolphin, as well as the surface of the face, just cranial to the eye. What we see in these lesions is areas of central ulceration. These tend to be very chronic and long-standing lesions. They tend not to spread very much except for mild local spread, and these certainly can be present on animals for years. When we look histologically at these lesions, within the inflammatory reaction, you can generally see abundant PAS-positive globoid organisms. Oftentimes they're arranged in chains, and between the globoid organisms there's a thin neck connecting them. This is a very interesting agent. This condition has been seen in man and dolphins, and not a lot of species in between. It's not an agent that is currently able to be cultured. Certainly we can take the organism. If we macerate the organism and do a mouse foot pad injection, we can demonstrate infection with growth into mice, but it's not something that is easily transferred from dolphins or man to any other animal. It's an interesting fungal infection because it tends to be associated with South America, Florida, and somewhat the Gulf of Mexico, but in general is otherwise pretty significantly geographically limited. So it's a good one to know because when we talk about diseases of cetaceans, this is one in particular that's a little funky and certainly a disease of cetaceans that I can't give you a terrestrial counterpart except for the condition in man. Now, when I think about marine mammals and fungal infections, what I think about is rapid aggressive infections. This is an Apophysomyces elegans dermatitis, and you can see very quickly as this animal was monitored over time that the infections extended locally very significantly and then actually extended deep. This animal died from septicemic spread of this infection, and you can appreciate very easily that as the cutaneous condition expanded, it became very significant as a cause of mortality in this animal. I'd like to shift now to conditions that you know and love. This is a granulomatous pneumonia associated with aspergillosis. Aspergillosis in a dolphin is going to look very similar to aspergillosis in other species that you know. It's a granulomatous pneumonia. If we take a look at the nose of a walrus, what this is a coronal section of the head of a walrus. To the left of us, we've got the brain case, and we're looking here at the sinuses and nasal conchae. In the lower half of the picture, you can appreciate the black infiltrate, which is the aspergillus organisms within the ethmoids here. These conditions can progress and actually migrate through and invade the brain by going through the brain case. Dr. D. McAloose at the Wildlife Conservation Society just recently presented a stunning case where they couldn't identify the primary source of infection, but the marked invasion into brain tissue with associated thrombosis, hemorrhage, and necrosis was certainly the cause of death in that animal. So Aspergillus rhinitis in this case, again, Aspergillus granulomatous inflammatory reactions in both marine mammals and terrestrial animals, so it's a condition that should be easy to diagnose, just comparatively assessing things. Now, dolphins, cetaceans in particular, again, have unusual presentations of some conditions you know. What we're looking at here is a cross-section through the trachea of a dolphin, and you can appreciate that we have a pronounced inflammatory condition that actually caused obstruction and suffocation in the animal. This is dolphin obstructive tracheitis, and you can appreciate when we look at the sections longitudinally that we have marked expansion in the mucosa and submucosa. This is associated again with Aspergillus infections. These changes have been seen in other bottlenose dolphin with rhizopus infections. So likely because of the high vascularity of the dolphin tracheal mucosa, we can end up with marked inflammatory reactions secondary to these fungal infections and these severe enough inflammatory changes that we actually end up with an obstructive tracheitis. If we clean up these kind of presentations, you can see here that actually the cartilage of the wall of the trachea is destroyed by the infection, and again, the extensive inflammatory reaction is pretty impressive in this case. Just one last view of a non-obstructive but similar type granulomatous inflammatory reaction here in the trachea of an animal. This is actually tissue from a sea otter. These slides were sent to me by Dr. Melissa Miller of Santa Cruz, California. This is coccidiomycosis. C. immitis is an important pathogen of otters. It has been seen in both pinnipeds and dolphins. And it's associated with chronic granulomatous or pyogranulomatous changes in multiple organs. Here you can see changes in the liver. If you look at the upper right-hand corner of the photo, you've got the spleen with similar type changes. And you don't have to use too much imagination to appreciate that that pulmonary parenchyma is firm with pneumonia. And again, similar multifocal changes associated with this sort of condition. Histologically, when we take a look at these, we see spherules containing endospores within the inflammatory reaction. Here's another animal. We've got liver on the left and spleen on the right. It's easy to see that this kind of condition is associated with very distinct multifocal granulomatous or pyogranulomatous changes throughout the parenchyma. Whew. That was enough fungus for us for the morning. What I'd like to do now is start taking a look at viral diseases. I don't think we'll complete the viral diseases in this hour, but at least we'll start taking a look at them, and then we'll finish taking a look at them in the next section of this tape. The first viral disease I want to take a look at is sort of a classic when we talk about marine mammal infections. This is the back of a dolphin, and what you're looking at is a cetacean pox infection or cetacean tattoo. What you can see, and it's easy to see how the disease got its name, is the three dark circles with sort of an irregular presentation within them, and that's just an area of pigmentary change associated with the infection. Here's a close-up of the lesion of on the head of a common dolphin, and what we see, and you can really appreciate here, is that this is not a proliferative poxviral dermatitis. It's much more an area of hyperpigmentation. Cetacean poxviral infections are associated with a virus that's in the family orthopoxviruses. These infections are most common in young or immunologically stressed animals. The infections and presentation of the lesions tend to be transient, so you may see the presentation one day and then watch it wax and wane over a period of time. And certainly these infections don't have a big clinical impact, but we can use them to sort of monitor things in the health status and general condition of the animals. This is a rather benign condition, and again, overall clinical impact very mild to insignificant in these animals. Now we can contrast that with poxviral infections in pinnipeds. What we're looking at here is a pox infection on the head of a young California sea lion. Pox in these animals is a parapox virus, and it's associated with an ulcerative and proliferative dermatitis. You can see these areas here. We have very, very distinct pox nodules on the face of this animal. If we take a look sort of moving back at a different animal, oh, sorry, let's not look at him yet. What's important about these is that these are commonly a portal of entry for more significant bacterial infections. So if you're a young sea lion, you really don't want to get these infections because unfortunately the pox virus itself isn't going to be a big deal for you, but the secondary bacterial infections can really be a problem for these animals. Now, this guy here is an elephant seal, and I've got him in here because he has a presentation that we think is a different kind of pox virus, but it's important to know about because this is very typical of a presentation that was seen recently in harbor seals in the German North Sea. If you take a look at the tongue of this animal, in the center of the tongue you see an area that actually looks like someone put a big extra chunk of tongue there. That's actually a proliferative area of glossitis in this animal. And in the harbor seals in Germany, that was a pox viral infection. This animal did terrific and actually healed up and was good for release. So we don't know for sure if this was a pox viral infection in this animal, but the presentation is highly suggestive of the lesions that they saw in the German harbor seals. So there's a very good likelihood that the etiology of this change in the elephant seal was the same as what they saw in those German harbor seals. This is another one of the classic marine mammal lesions that you need to have a good handle on. Here we're looking at the flipper of a California sea lion. And what you can appreciate is at the tip of the flipper and somewhat more towards the center of the flipper, you can see areas where we have ulcerations, and these are secondary to rupture of vesicles that this animal had. These are the gross presentation of San Miguel sea lion virus, a calicivirus infection in sea lions. Now, why is this such an important infection? Well, it's important because a number of years ago, sea lions went into the food stream for pigs. And when the pigs ate sea lion-associated food, they developed a condition called vesicular exanthema. And vesicular exanthema in swine presents, again, as you'd imagine, as a vesicular disease. And when we have pigs in the United States with a vesicular disease, folks get a little bit concerned. This condition has not been seen in pigs for a number of years in the United States, but we certainly do still see these lesions associated with this calicivirus in sea lions in stranded animal facilities throughout the United States. There continue to be investigations into marine animal caliciviruses. These are generally now termed vesiviruses, and the vesiviruses are associated both with dermatitis as well as conditions of concern like abortion in a number of marine mammal species. Now I want to get to a significant marine mammal virus that's significant not so much for its gross lesions, but because of the significant mortality it can be associated with. What we're looking at here is the lung of a harbor seal, and you can easily appreciate that diffusely the lung is congested. If you could feel this, it would be thickened throughout the pulmonary parenchyma, and the reason it would be like that is this is a phocine distemper or morbillivirus infection. Now, the morbilliviruses are a group of viruses that are significant to a number of different marine mammals. We've got in pinnipeds, phocine distemper, as well as canine distemper virus that can cause significant mortality in these animals. In dolphins and whales, we've got a cetacean morbillivirus, a porpoise morbillivirus, and a pilot whale morbillivirus. And these conditions, just like, again, morbillivirus infections that you know, are associated with a bronchointerstitial pneumonia, type 2 pneumocyte hyperplasia. In the brain, we'll see a non-suppurative encephalitis. You can see areas of demyelination. I've got a shot here of a harbor seal, and this is to help you appreciate that we get conjunctivitis, periocular swelling. It doesn't take any imagination to realize that this guy's eyes are killing him. Well, they're killing him because of the inflammation and the debris that he's got associated with them. This has been identified in hooded and harp seals. Now, in nice cases, you'll see syncytia histologically, and you'll go, hey, this could be one of those morbilliviral infections. But again, remember we talked about viral infections and secondary bacterial concerns. You need to make sure that you can look through the bacterial infections and see the impact of the virus and the changes that are associated with the viral infections. When I talk about sort of comparing marine mammal conditions to conditions you know, the impacts in whales and dolphins, so the cetacean morbilliviruses, are very similar to the peste de petits ruminants, the infection that you may know in small ruminants. Again, an exotic disease, but a disease of concern. Now I'm going to spend what you may think is way too much time, but what I may think can never be enough time, on a condition particular to sea lions. And it's a condition particular to sea lions because it's associated with a number of factors that actually promote development of this disease in these animals. What we're looking at here is the bladder from a California sea lion. And just below the blade of the scalpel, you can appreciate that there's some irregular thickening within the bladder. What you're seeing is an expression of a carcinoma in situ in the urinary bladder of a California sea lion. Now, I've got this picture in here to demonstrate how mild the lesions associated with this condition can be. This is a more typical presentation, and what we're looking at here is the abdomen of a California sea lion. And if you look at the top of the photo, you can see the kidney, which is somewhat expanded because we've got a hydronephrosis, and sort of the big mass in the middle is a hydroureter and a markedly expanded lymph node. Well, these changes are there because this is a presentation of urogenital carcinoma in California sea lions. Urogenital carcinoma is not just an interesting kind of neoplastic condition. This is a contagious condition associated with a gamma herpes virus, uterine herpes virus 1. And this condition is important to know because it does all the things that you would expect with a carcinoma. Here we're looking at marked multifocal metastatic infiltrates within both the lung and the liver. And if you look sort of just northeast of the center, you can see the spleen, again, with foci of carcinoma invasion. A typical presentation of the lesions in the kidneys of these animals is like this, where we have multiple raniculi that are just replaced with neoplastic infiltrates. This condition is important simply because it is a viral-associated neoplastic condition, and in addition to having the virus, the folks at UC Davis have determined that there's an interrelatedness of the virus, PCBs, as well as genetic components of these sea lion populations that really all work together to result in the development of these infections. Now, I know I've got a lot of photos on this, but I've got a lot of photos because this is a very significant condition, and you really need to know about this infection. As we move through with things, you can appreciate here we've got cross-sections of kidneys. If I saw a picture of kidney cross-sections with any sort of neoplastic invasion and it was tissue from a California sea lion, I would specifically be looking for this kind of diagnosis. Here we've got tissues from that animal where we just saw that mess of the abdomen. On the left, that small kidney you see is actually very atrophic simply because you can see the significant hydroureter. We had secondary hydronephrosis. What happens in these cases is we get neoplastic infiltrate into the lymph nodes. The lymph nodes then obstruct the ureter, or we can also have neoplastic infiltrates within the ureters. Those cause obstruction. You get secondary hydroureter and hydronephrosis. And then on the other kidney, we do have small areas of hydronephrosis, but it's nothing compared to the one that was primarily impacted. Lastly, there are some external signs that we very typically associate with this condition. What we're looking at here is the hind end of an adult female California sea lion. And again, not too much imagination to appreciate that the flippers are really markedly enlarged. And what you're looking at is the perianal and the perianal tissues. They are expanded with edema. And the reason we have all this hind end edema is that when you have a urogenital or vaginal carcinoma, you tend to go to the lymph nodes that are draining the hind end. When those lymph nodes are invaded, they don't drain well, and so we have secondary development of edema. Now, this needs to be compared and contrasted with changes like this. This is a vaginal prolapse, and we have a vaginal prolapse in this animal because she felt uncomfortable because there was something in her vagina that didn't seem to belong there. And as she pushed and pushed and pushed, she finally pushed out what didn't belong there, but unfortunately, it was directly attached to her vagina. So she ended up with a vaginal prolapse. Urogenital carcinoma isn't the only thing that can cause vaginal prolapse, but when we see changes like this, very high on our rule-out list are things like urogenital carcinoma in California sea lions associated with a viral infection, uterine herpes virus 1. Last but not least, I just want to give you a sense of the fact that even when these sort of conditions change, make changes that are unusual, they're the kind of changes that you've seen and can recognize in terrestrial animals. What we're looking at here is the spine from one of these impacted animals, and we've got metastasis that's invaded into a vertebral body with secondary fracture that's associated with the neoplastic invasion into the vertebral body. This animal presented with hind limb paralysis, but again, on your list of differentials for acute hind limb paralysis, needs to be things like spinal cord or vertebral body trauma, as well as potentially neoplastic invasion and secondary fracture from damage to the vertebral bodies. One last picture, I promise. This is an area just showing the typical pulmonary carcinomatosis. You can really appreciate here that we've got pleural tissue that's multifocally expanded with invasion of metastatic changes from this neoplastic condition. It's not that I don't have a billion pictures of this disease, which I do. It's that this is a really significant disease in sea lions, and it's one that I think you need to know. I'm going to do just a couple more viruses, and then we'll take a break and go on to the second DVD. So I want to leave you with something which is not sea lion herpes virus. I want to leave you with sort of a novel and developing condition, and the stories about what it's like to do marine mammal investigations. This is a section of liver from a beluga whale, and you can appreciate that the liver is diffusely sort of compressed. It's flaccid looking, and we have multifocal areas here where you can see necrosis and congestion. When I first saw this liver, I said, this ain't right, and this is certainly what caused the problem with this animal. But it actually took interactions with a variety of facilities throughout the U.S. to sort of figure out what was going on here. We got electron micrographs that demonstrated small viral particles abundantly scattered within the hepatocytes from the folks at UC Davis. Those EM photomicrographs were evaluated by researchers literally throughout the world. And then using a viral microarray, we were able to identify a novel coronavirus associated with this hepatitis in this animal. The point of this picture in particular is to remind you that there are some conditions that we don't have good terrestrial counterparts for. And this condition, we don't even have a good marine mammal counterpart for. This coronavirus infection may have come from other marine mammals, may have come from marine birds. But if we don't take our diagnostic results and take them as far as we can, we won't be able to advance marine mammal pathology. So I want the take-home message at the end of this DVD to be that you know a number of these conditions because you know them in terrestrial animals, that there are a number of conditions that are specific to marine mammals, so we need to keep that in mind when evaluating marine mammals. And lastly, that there are a number of conditions that have not been described either in terrestrial or marine mammals. So when we come across something new and different, we really need to take it as far as we can to advance what we know in marine mammal diagnostic pathology. Let's stop here, take a break, get a beverage, do what you need to do, and then we'll come back, take a look at some more viral diseases, and then a variety of other conditions in marine mammals. Thanks so much. Welcome back. I'm Dr. Judy St. Ledger. I'm the veterinary pathologist for SeaWorld, and we're taking a look at the gross pathology of diseases of marine mammals. On the first part of this DVD, we took a look at some important bacterial, fungal, and some viral diseases of both pinnipeds and cetaceans. I'd like to continue now with viral diseases in these animals, and then get into some more sort of general, nonspecific, as well as parasitic, neoplastic conditions. So I'd like to start off now. And what we're looking at is the upper palate of a harbor seal. And you can appreciate here that this animal has some focal ulcerations here within the mucosa of the mouth. These areas of ulceration are very common and very typical of an infection that we call seal herpes virus. In seal herpes virus, the condition is caused by Phoceid herpes virus 1. And what's important in this condition is that not only do we see areas like those ulcerations, sorry about that, but we can see a sudden death in these animals. And we end up with sudden death in these animals because we also will commonly get a virus-associated acute adrenalitis. And with that adrenal inflammation, we get adrenal necrosis, and these animals can go into an acute adrenal crisis. If we move on from this guy, let's take a look at another herpes infection. What we're looking at here is the corneal surface from a California sea lion. And this is a very interesting viral condition. When this was first seen, these pictures are from Dr. Marty Helena, and this condition was seen in a stranded animal facility. When he saw these corneal changes, like the excellent clinician he is, Marty said, well, this condition can be caused by a number of things. So the first thing he did was he took a look at the water quality. And he made sure that the water quality was appropriate for keeping these animals, and he found some changes, and he said, you know, maybe I've got trouble associated with my water quality. He said, well, these kind of conditions could be associated with, you know, excess UV in these animals, or it could be an infectious agent. Well, the water quality looked highly suspect, and so they sort of cleaned up the water and the problem went away. But some of these animals didn't make it. And in the animals that didn't make it, that when they took a look at the ocular tissues and did some virus isolation work on the ocular tissues, they identified this novel herpes virus. So what's important is that we need to be ever mindful of the possibility of viral infections causing conditions, even if we have less than ideal environmental conditions that may contribute to the cause. Most likely, we had a combined effect of less than perfect water quality as well as the viral infection causing these significant lesions. All right, no more herpes, but what we have here is the penis from a dolphin. This is a penile papilloma. Here in the center of this penis, you can appreciate we have a focal area of well-circumscribed proliferation of the mucosa, and that is a penile papilloma from a wild dolphin. This is also a herpes viral infection, but it's causing a papillomatous change. These papillomatous changes can be seen both in the penis or vaginal tissues of dolphins, as well as in the mouths of animals. This is a bottlenose dolphin, and here I think you can appreciate that there's a multifocal area at the tip of the tongue where there's a proliferative papillomatous type lesion. These papillomas again are associated with are associated with the herpes virus. And I was jumping a little bit ahead because we know that in multiple animals, these areas of marked proliferation can unfortunately lead to changes like this. This is a sublingual lesion, and what we have is areas where we had previously diagnosed papillomas that have now progressed to a squamous cell carcinoma. These conditions are being diagnosed more and more often in a variety of cetacean species. It's the bottlenose that we're focusing on these days, but it's not going to surprise me if we find a number of different cetacean species where we have changes both of papillomatous proliferation and advancement to squamous cell carcinoma. We know that in the captive animals that have had this problem, when we have changes in immune status associated with conditions like pregnancy, advancement of the neoplastic condition really moves forward very quickly. So it's important to remember that not only do we have here what starts out as a viral infection, progresses to a benign type change, but then can actually transform into a neoplastic change, but we have a significant impact of immune function on progression of this disease and its character in a variety of animal species. I think we're going to continue to learn more about this problem as time goes on, but certainly it's one to keep an eye on and one to know about if you're working with marine mammals in particular. Now, what's important is sometimes a papilloma is just a papilloma. And what we're looking at here is the head of a Florida manatee, and I think you can appreciate just coddled to the nose on the left-hand side of the picture, those areas of raised white bumps arranged pretty much in a linear fashion. If we take a look at another animal with a similar lesion, you can appreciate that each is a distinct bump, but all of these are papillomas. And these are associated with a manatee papilloma virus. Now, what I like about manatee papillomas, in the first part of this talk, we talked a lot about sort of comparative pathology and conditions you know in terrestrial animals versus similar conditions in marine mammals. A nice feature about papilloma viruses in particular is that immunohistochemistry for terrestrial animals like bovine papillomavirus will cross-react with manatee papillomavirus. So we can identify the presence of the virus within the lesions using an immunohistochemical technique developed for evaluating cattle. All right, enough viruses, I promise. Now we need to move on to parasitic conditions. When we're working specifically with wild animals, parasitic conditions are very common. And in a perfect world, most parasitic conditions are not significant enough to be fatal, but they oftentimes will have some clinical importance, and so I like to take a look at some of those kind of parasitic conditions. The first is an impressive condition, and it's a good one to know simply because it's an unusual presentation but a striking gross photo. What we're looking at here is intercostal muscles from a California sea lion, and you can see that almost all of the muscle is replaced or expanded by these areas of white linear changes within the muscle. These are areas of both myositis as well as infiltrate with protozoal cysts. And this is sarcocystosis in a California sea lion. Now, although we have sarcocysts present within skeletal muscle and cardiac muscle in these animals, we can have reactions that we see in those tissues as well as diaphragm, and those reactions can be very significant. We don't know if that's an allergic reaction, a change in the immune response to these animals, but certainly we can have changes that cause significant muscle-associated inflammation associated with these infections. To make matters a little bit more confusing, we know that pinnipeds can also develop an acute necrotizing hepatitis associated with infection with Sarcocystis canis. This is not Sarcocystis canis. This is most typical of Sarcocystis neurona, but there's nothing to prevent marine mammals from having, again, their own sort of infections that are similar to but slightly different from terrestrial infections that you know. Now this is, if you haven't seen these before, it's going to be tough to figure out where you are. This is actually a shot from a seal where we've removed part of the palate and you're looking up into the nasal cavity. What you see here is a number of very small, oblong, parasitic organisms, and they're associated, you can see the areas of redness. Maybe you can appreciate towards the right-hand part of the slide a little bit of extra mucus there. This is sort of a mild multifocal or catarrhal rhinitis here in this animal. There are some different nasal mite species that can cause these kind of problems. There's Orthohalorachne attenuata, Orthohalorachne diminuata in sea lions and seals in particular. In the sea otter, the pathogenic, well, the significant nasal mite is Halorachne moringae. Now, nasal mites are cool because you can stick a little light in the nose and see them crawling around, but if you want to look at respiratory associated parasites that really cause significant damage to animals, let's take a look at lungworms. And let's start with a nice impressive set of lungs from a California sea lion. Everyone can really appreciate that throughout these lungs here we have multifocal areas of diffuse, extensive hemorrhagic pneumonia that's impacting about 2/3 to 3/4 of the pulmonary parenchyma here. This is pneumonia secondary to Paraphiloroides decorus infections. These infections can be significant in young sea lions. They're generally associated with the airways, so the typical lesion is sort of a multifocal bronchopneumonia. But like in this photo, you can really appreciate that we get significant extension with edema and hemorrhage throughout large areas of pulmonary parenchyma. Now, it's not uncommon to see these parasites present in low numbers with almost minimal to no inflammatory reaction in adult animals. And it's likely that their immune systems really become used to the presence of the worms and we end up with a balance. But it's in the young pup or yearling sea lions that we can actually see death associated with these infections and then secondary bacterial infections that invade and cause the death of these animals. The adults and the larvae are present within the alveoli of the lungs, and the cycle of the organism likely is associated with ingestion of opal-eye fish. But remember, it's those secondary bacterial infections that really can cause mortality of these animals associated with this lungworm. Now, if we really want to go to a cool lungworm, let's go to the elephant seal species and take a look at the seal lungworm, which is Otostrongylus circumlatus. Otostrongylus is significant in that we tend to see the adults in the bronchi and bronchioles, but it's the migratory pathway of this organism through the vessels that causes an interesting arteritis and a significant vascular thrombosis and occlusion that makes this such an interesting kind of parasitic infection. You can appreciate here these lungs from a seal that the areas that are impacted look really very turgid with areas of hemorrhage, congestion, and edema. And that's because the vascular supply to those areas is significantly impacted by the presence of the parasites. If we take a look a little bit closer, we open up vessels, you can see there's actually a verminous thrombus here, and you have significant changes in the vascular flow as things go to and from the lungs. Now, as with everyone, I picked my best, most impressive shots, and getting a nice view of hundreds of worms within the pulmonary vessels is not what we see on a day-to-day basis. But certainly, it's not uncommon to see at least a few of these parasites within the vessels, specifically of the lungs, and again associated with both an arteritis as well as the pneumonia in these guys. There is an interesting secondary sequela in that it's not uncommon for somewhat debilitated or normal-looking elephant seals in particular to develop an acute DIC-like incidence that seems to be associated with a reaction to these worms as they migrate through to the lung parenchyma. We're still sort of working out on good ways to identify DIC and ways to manage these infections, but until those are sort of worked out, this will continue to be a very impressive pathologic lesion in these species. Now, if we want to get a sense of, are we sure that we've got Odostrongylus, here's a nice cross-section that helps you really to believe me when I say these organisms are in the vessels of the animals. You can appreciate here that we have a cartilage-lined airway, but that the worms are not within the larger cartilage-lined airway. If you look just above it, you can see the multiple worms coming out of the blood vessel of the lungs. Now, it's not just pinnipeds that get lungworms. And certainly, as we look here in the lungs of this dolphin, you can see we've got a patchy bronchopneumonia in this animal. If we take a look at this lung on cross-section, what you see is, and contrast this to what we saw in the seals, within the cartilage-lined airways, multiple nematode lungworms. These are Halocercus. And Halocercus, like airway-associated nematodes in multiple species, causes a bronchopneumonia, again, with nematodes present within the airways. And these sort of set these animals up specifically for secondary bacterial infections as they act as local irritants within the airway and sort of disrupt the normal immune status of the airways of the animal. Enough lungworms. Let's take a look at sort of a typical presentation of a Florida dolphin. Unfortunately, not every marine mammal specimen we look at is as fresh as a daisy. A lot of marine mammals that we take a look at are animals that have been stranded, and they're often found on the beach dead. And I've got this picture in here to demonstrate that there are some lesions that are so classic that even when the tissue itself is in not great postmortem condition, we can make a diagnosis if we're familiar with some of the conditions that we'd see. What we're actually looking at here is the stomach of a dolphin. This is cetacean gastric trematodiasis, and all of these small white bubbles are Bronina species. So what we have is, here we have some of these trematodes that are all present within small raised areas of the gastric mucosa. I've got a slightly fresher section, but unfortunately what you can see is on this photograph that we have a moderate amount of mucus sort of stuck within these areas where we have the trematodes within the gastric glands. Well, I really prefer pictures of fresh tissue, and everybody likes a good ulcer. So what we're looking at here, we've gone back to pinnipeds. We're looking at the stomach of a sea lion, and we have chronic gastric ulcerations with centralized gastric nematodes. In sea lions and seals, the typical nematodes that we're going to see are Anisakis and Contracecum species. These worms are very commonly seen within the center of gastric ulcerations, and it's not uncommon to see a granulomatous bed of tissue within these very chronic ulcerations of these animals. Now, it's important to remember when folks say, hey, you've got gastric ulcerations, do you have problems is there a bacterial component to this? Well, certainly we've got bacterial issues in these, but these are nematode-associated gastric ulcerations. I want to move now from the nematodes to acanthocephalans. And here we're looking at acanthocephalans associated with the intestine of sea lions, and these are associated with a very mild multifocal colitis. Where these animals embed their heads and attach, they cause local irritation, but generally not more than that. These organisms are corinosoma. However, not all acanthocephalan infections in marine mammals are so benign. This is the serosal surface, and remember, parasites belong inside the intestines, not outside. This is the serosal surface of the intestines of an otter. And I think you can easily appreciate that multifocally, we have areas here where there's been penetration through the intestinal wall with parasites that are actually present within the serosal surface. If we back out and take a big view of this sea otter, what you're looking at here is sort of the general peritoneum of this animal. And you can appreciate that what we have is multifocal perforating enteritis with a marked secondary peritonitis. This infection is associated with the acanthocephalan Prophylocolus, and this acanthocephalan is associated with mortality and disease in sea otters. These pictures come from Melissa Miller up in Santa Cruz, and again, you can appreciate that she sees a number of significant agents of mortality in sea otters, and this is definitely on the list of significant conditions. Now, remember when we took a look at fungal infections, and we talked about the fact that you can have fungal infections and bacterial infections associated with damage to the brain. A significant pathogen that causes damage to the brain that you need to know about are the Nasotrema flukes. And what you need to know is that Nasotrema belongs in the upper airways. So it should be in the nasal sacs. It can, even if it gets a little wacky, migrate and impact things like the ears as it goes through eustachian tubes. But what's important is sometimes it goes completely nuts and it can migrate through and cause lesions on the brain. What's important is those lesions on the brain tend to be associated with two specific areas. Either, like in this picture, the frontolateral area of the cerebrum, with a focal necrotizing encephalitis, or a more subtle sort of chronic, almost fibrinous or fibrous meningitis associated with deposition of eggs from the trematodes to a lesion like this. And here we're at the ventral cerebellum, and what you can see is this focally extensive area of necrosis and hemorrhage. If you see this grossly, you have to remember that a great rule out for this is a fungal infection, but this again is another case of Nasotrema aberrant migration causing significant damage to the cerebellum. If we take that brain section and we fix it, you can prove to yourself very easily that I'm not fibbing and just sticking blood clots on top of the parenchyma. You can see the marked damage here within the parenchyma, and actually the somewhat disparity of the entire side of the cerebrum from that same animal. So this is aberrant fluke migration of Nasotrema flukes that belong in the nasal sacs of a variety of small cetacean species. Now, everybody's got their favorite liver flukes. My favorite liver flukes come from dolphins. Just like when we talk about comparative pathology, the lesions in these animals are very, very similar to the sort of lesions with liver flukes in cattle. So what we have here is Campula species, commonly Campula oblonga. And the Campula are present, as in this case, what we've got just to the northeast of center is a bile duct with a small Campula organism. Commonly we'll see a chronic reactive hepatitis. You can have biliary fibrosis. If we took an up-close picture of that guy, this came to me from Dr. Linda Lowenstein, and I actually absolutely love it because you can see the trematode very clearly. You can see without any imagination needed that the bile duct is thickened, and you can really appreciate that although this guy isn't big, he can cause some significant damage within the liver parenchyma. Most of the time it's a very mild subclinical infection, but we can have conditions where they cause marked reaction and actually significant biliary fibrosis. Again, that's the exception to the rule. This is a parasite that normally isn't going to take out its host. Let's stick with flatworms, but let's go to the cestodes. And what this is a picture here of, on the right we've got a very small testicle, bottom part of the picture. And above that you've got epididymis. On the left you've got almost two sort of anastomosing cystic spaces. It's like a cystic species, only different. This is monorrhigma. Monorrhigma is a cestode cyst present within the abdomen of a variety of small odontocetes species. These come from a common dolphin. What's important is there are two important cestodes that have cystic structures within common dolphins. The second is the one which is more impressive. The second is Philobothrium delphinii. Philobothrium delphinii is an impressive organism simply because it's got a preferred site of predilection. What we're looking at here is a tremendous number of cestode cysts in the subdermal and blubber layers of this dolphin. And where we are in respect to the whole dolphin's body is in the inguinal region. And you may think, you know, what the heck is the significance of that? Why is that important? Well, that's important simply because what we see is that these organisms tend to be in a place where these dolphins actually get bit by sharks. And you think, what's the deal? Why is that important? Well, they've actually done some research and determined that the way this organism completes its life cycle and gets to its natural host, which is the shark, is that the shark come and they bite the dolphins. And the common site in which they bite the dolphins is in the inguinal region. So through natural selection, when this trematode is encysted in this area, it's in the perfect area to infect its natural hosts, sharks. We know that white sharks and common dolphins actually have such a relationship such that infections in common dolphins are more significant in areas where the populations of white sharks are higher. It's an interesting story, and certainly it's a nice way of looking at animals in the ocean interacting not only from an environmental perspective but in sharing and completing the life cycles of parasites. So I think that Philobothrium delphinii is a pretty good parasite because it tells some of the story of the ocean. It's multifocal blubber parasitic cysts. All right, let's move on and take a look at a couple toxicities. And the first one I want to take a look at is one that's important first and foremost for those of you who are studying for boards, because there was a recent publication looking at the pathology of the condition, but also because, especially on the west coast of the United States, this is a very significant condition both in pinnipeds and cetaceans. What you're looking at is a picture of 3 adult cetaceans that are essentially comatose. And I think it's important to understand a little bit of the clinical signs that we see with this condition. These animals are poorly responsive. They can demonstrate frank coma. It's not uncommon for them to have multiple, small or large and uncontrolled seizures. Certainly sudden death is even something we see in some of these animals. Now, there are some other less specific things. The condition is associated with a lot of itching response, so we can see a lot of scratching. And as folks are looking more and more into the chronic impacts of this intoxication, the animals seem to have some behavioral modifications that are a little bit funky. They've actually found these animals in places like strip malls. Now, I'm no biologist, by training, but certainly I don't think sea lions belong at strip malls. They don't have purses. They have no way to purchase things. So when we see behavior like that, something is significantly impacting the population. Well, what is significantly impacting them is damage to their hippocampus and their brain. And this shot here, I think you can easily appreciate that the hippocampus on the right has marked degeneration and atrophy. And this is sort of the chronic presentation of the acute lesion. The acute lesion results in marked degeneration and necrosis of the hippocampal dentate gyrus, of CA1, 3, and 4 of the hippocampal horn. Now, it's not simply the hippocampus that is damaged with this intoxication. We also have areas of myocardial degeneration. What we're looking at here is the heart of a California sea lion, and just above the ruler, I hope you can appreciate the focally extensive area of pallor. We do have significant cardiac damage also associated with this intoxication. This is an aborted fetus and placenta, and we do see a tremendous number of abortions. It's an interesting toxin in that it's a very small acid, domoic acid. And so it travels freely throughout the body, and it binds to glutamate receptors. What's interesting is it also travels into the amniotic fluid and can impact the fetus. And certainly more investigation needs to be pursued to evaluate, are we seeing impacts on these fetuses, because a number of these pups have been delivered, and it's not uncommon, if the toxicities occur late in the season, for the pups to be delivered fresh, as fresh abortions, as stillborns, even as late-term pregnancies that are delivered and then can be raised up. Right now there are about 15 of these pups throughout the United States, and at least a couple of them are a little funky in the head, but many of them actually seem pretty normal. So we have an interesting population really to use to potentially study the impacts of these intoxications on the pups of impacted dams. Just a little bit about domoic acid. It is a marine biotoxin. It's produced by the diatom Pseudonychia australis. What's important about this is sea lions really demonstrate sort of the accumulation of the toxin up the food chain. The diatom is consumed by anchovies. The anchovies are then consumed by the sea lions. So this really sort of goes to the things you learn in early biology with bioaccumulation, and large numbers of these animals are impacted. Not just sea lions. We certainly see pelicans that are impacted. We can also see dolphins that are impacted. So this is not simply a condition of sea lions. It is a condition of multiple marine life species, and because of it, it is one of significant note to know about. Another condition of significant note to know about has far fewer significant gross findings, but is no less significant, and that's brevetoxicosis. What we're looking at here is actually the lung of a dolphin, and the point of seeing this is just to demonstrate the non-specific signs associated with brevetoxicosis. Brevetoxin is a toxin, so it's a much larger molecule than domoic acid, but it's also a bit of an irritant. So what we tend to see in these animals that are dying from brevetoxicosis is they'll commonly have a very non-specific pulmonary congestion. The nice thing about brevetoxin, specifically as compared to domoic acid, is because the toxin is a large protein, we are able to use immunohistochemistry to demonstrate the presence of the toxin within the animals. The folks at Harbor Brandt's Oceanographic Institute have developed an immunohistochemistry, and we can identify the presence of the toxin within cells in the lymph nodes of these animals to really help with a conclusive diagnosis in these cases. Let's move on from toxins. There are a number of toxins that we haven't really talked about or looked at, but a big part of the reason is that they don't have specific gross lesions. Doesn't mean they aren't significant, but we want to focus on conditions that have significant gross lesions. As we move into neoplasia, remember, we've already looked at a number of very significant neoplastic conditions you need to know about. There is the neoplasia associated with sea lion herpes virus, and certainly the development of squamous cell carcinomas associated with oral and mucocutaneous papillomas, again associated with a herpes virus. But let's look at some neoplastic conditions that we can compare and contrast the marine mammal presentation with the terrestrial animal presentation. And what's important about neoplastic conditions is that there was just a lovely overview, sort of a review of the cases of reported marine mammal neoplasia that was published in VetPath in 2006. I strongly recommend that people take a look at that paper. It's a wonderful review, and what's nice is it takes a look at all the cases that were presented and sort of says, here's kind of where the body of knowledge is these days in marine mammal neoplasia. I've got this picture up here. This is tissue from a California sea lion. And I've got this picture up here because I think it so exquisitely demonstrates that if conditions aren't in the current literature, sadly it doesn't mean that they haven't existed, it simply means that folks haven't yet taken the time to write them up, and I'm guilty as everyone. This is a case of mine, and what you see here is in the temporal lobe we have a focal, distinct area of sort of expansion with a mucinous neoplasia. If this were tissue from a dog, you'd feel very comfortable saying this is an oligodendroglioma. Well, this is an oligodendroglioma in a sea lion. So what's important about this is you want to make sure that you know the neoplastic conditions that have been described in marine mammals, but you also want to remember the neoplastic conditions you know from terrestrial animals, and when you see a similar lesion in marine mammals, feel comfortable making the call and saying, if this were a dog, this would be bada bada bada. That can really direct investigations in conditions of marine mammals. Similarly, these are pictures of an Atlantic white-sided dolphin. And what we see here is at the mucocutaneous junction, sort of a locally aggressive, infiltrative lesion that is really at the junction of the skin and the oral tissue. As this progressed, we can see it was locally invading, and it damaged the gums such that the teeth were disrupted and the normal dental arcade was distorted. This is a squamous cell carcinoma in a Pacific white-sided dolphin. But again, if you saw this kind of lesion in a cat, you wouldn't think twice about saying, hey, that's a squamous cell carcinoma. The last one of these comparative neoplastic conditions, here we have the brain from a common dolphin. And again, it's not difficult to appreciate that in the lower right-hand corner, you have a significant, distinct mass. If I told you this was a young common dolphin, as it was, this animal was 2 years old, you would say, in terrestrial animals, if I had a young dog with a lesion in that area, I'd be thinking neuroectodermal tumor, and that's exactly what this is here. So when it comes to neoplastic conditions, you may not have seen it before, but you may know something in terrestrial animals. You can apply it to these animals. Let's look at some non-infectious condition. This is a little bit of potpourri. It's even some normal things that you should know about, but what's important is there are conditions that don't fall nicely into those infectious categories that are important. Here what we're looking at is the teeth of a California sea lion. And what's important about these is the marked discoloration of the teeth. Sometimes when we work with exotic species, you have to know a little bit about the species to know what you're looking at. And when I first saw this, I said, my God, we've got porphyria in a sea lion. And the folks I was working with chuckled at me a little bit and said, it'd be good if you knew about dental tartar in California sea lions. This is a very common, normal finding. We see this in animals literally even after a few months of age, and it's very common and normal for them. Another great example, I did a necropsy on a bearded seal just a few days ago, and the animal's teeth were worn down to the gum line. When I first saw it, I thought, my God, this animal just has erupting teeth. And as I began to examine the teeth a little bit more closely, you could really appreciate that they were in truth adult-sized teeth that had been worn down. Well, in the bearded seal, wearing teeth down to the gum line is normal. So there are some specific features of marine mammals that you simply need to know as you investigate these species. I've got this in here not because it's special or magic, but what we have here is a cranial ventral pneumonia in a walrus. And again, this is in here not because it's special or different. This could have easily been put into the bacterial section, but it's just to remind folks that a cranial ventral pneumonia in any marine mammal species is likely to be a bronchopneumonia. A more diffuse pneumonia throughout the pulmonary parenchyma may have more of an interstitial pattern, and certainly we think of different kinds of agents in bronchopneumonias than we do with interstitial pneumonias. There's no difference in marine mammals. There are some other funky non-infectious things though that are specific to marine mammals. Here we've got the heart from a dwarf sperm whale, and in both pygmy and dwarf sperm whales, the Koja species, we can have a mix of hypertrophic and dilatative cardiomyopathy. You can appreciate on the left side here we have the right ventricle, and it's markedly expanded. You don't even have to imagine to appreciate that the wall of that ventricle is flabby. Here on the left we've got much more expansion of the myocardium, and we actually have a little bit of a hypertrophic cardiomyopathy. So this is a bit of a mixed cardiomyopathy. When we look histologically at these hearts, there's myocellular degeneration, there's atrophy, there's fibrosis, and we have the secondary conditions you'd expect in heart disease. You can have chronic passive congestion in the liver. This condition has been seen in a number of pygmy and dwarf sperm whales, and investigations are going on to look at the possibility of toxicant impacts, to look at, is there a genetic component? What is the basis of this condition in these species? Because we see it rather commonly in those species. Another cardiac condition of concern is seen in California sea otters. No, this isn't a bowling pin. No, this isn't a California sea otter pretending it's a pear. This is significant ascites in a California sea otter. And he's got ascites because, again, of cardiac conditions. If we take a look at the heart of this animal, These animals have a variety of cardiac conditions that tend to be associated with a non-specific or less specific cardiac disease in California sea otters. They can have a cardiomegaly, as this animal has here, associated with myocarditis, or a dilated cardiomyopathy. And this is a great sort of what do you see slide, because if you look at the liver just below the diaphragm, you can easily appreciate that we have chronic hepatic congestion. If you look at the pulmonary tissue, you can see it looks very clearly like we have pulmonary edema. So this animal has a myocardial disease with a number of secondary sequelae associated with it. Now remember earlier we talked about conditions of marine mammals like domoic acid intoxication, which can damage the heart muscle. We talked about sarcocystis neurona, which can impact California sea otters. So there are a number of conditions we've talked about that can result in cardiac damage and can secondarily result in primary cardiac disease. This is just a bit of a gee whizzer, and I think every pathologist has sort of their drawer of gee whiz slides. Here we're looking at the abdominal aorta from another Pacific white-sided dolphin. And you can appreciate that within the aorta here we have sort of a diffuse scattered area of mineralization. This is atherosclerosis in an aged dolphin. Now, dolphins are fish-eating animals, and they tend to naturally ingest a pretty high-fat diet. Atherosclerosis is not a common condition in these species, but certainly as animals age, we do see chronic degenerative conditions in older animals as you do with terrestrial animals. It's not a big deal lesion, but it's an interesting lesion because it's good for that comparative pathology. Also good for comparative pathology is sort of the cardiac changes you'll see. This animal has both atherosclerosis, if you look at the aorta here, as well as valvular endocardiosis. Here, looking at heart valves a little bit closer, you can see we have multifocal areas of thickening of the heart valves. There is a valvular endocarditis that's of significance in marine mammals. In Alaskan sea otters, there is a bacterial-associated strep infanterius subspecies coli, I believe, infection that can cause a very significant marked cardiac valvular endocarditis. But this is endocardiosis, again, not an uncommon finding in older marine mammals. Generally, probably just an age-related change, no great shakes, but something to be aware of because it's so simple to comparatively assess this as compared to the terrestrial species that you're familiar with. I love marine mammals because when you present sort of an uncommon lesion in an uncommon species, it's hard to see the lesion, even when everyone knows what the lesion is. So what we're looking at here is a California sea lion, and there's something wrong with the sea lion. Can you sort of see what's wrong? Well, if you can't, don't feel bad because it's very hard to ascertain. If you look towards the left of the photo, you'll notice that we have cut profiles of ribs, and I'm going to try to use the arrow here, so bear with me for a second. No, I think the arrow's, oh, there we go. So here we have cut ribs. So we're in thoracic cavity here. So if you can appreciate that we're in thoracic cavity, and here's the diaphragm, then you should also be able to appreciate that we have large loops of bowel here in the thoracic cavity. And where I come from, we call that a diaphragmatic hernia. These can be associated as both congenital and traumatically acquired condition in California sea lions. This one was presumed to be congenital. This is always a difficult condition to photograph in California sea lions because they tend to have that dark musculature. But what's important is when you're taking a look at a photo, look not only for what you see, but for things that might be out of place. Once you know what this is, it's a very simple diagnosis to make. But if you just saw this photo, it would be tough to make simply because the stuff that's there looks like stuff that belongs there. It's just not in the right place. Another great example of something you know, but in a species you may not. This is another case of tissue from a California sea lion. What do we have here? Well, if we look at this, you can appreciate that we're looking at lungs, and you can appreciate that there's something expanded in between the lungs. Well, things that go in between the lungs that you know, that are sort of long and tubular, include the esophagus. So what we have here is a very expanded area of esophagus. So could you call this a megaesophagus and be right? You could. The reason we have a megaesophagus, when we open that esophagus up, is that we have a marked esophageal impaction. So a better diagnosis for this is esophageal impaction, but you need this picture to diagnose it. Now, how does a sea lion get esophageal impaction? Certainly, could we have a stricture in the esophagus? We could. Could we have something impinging on the esophagus from the outside, say a persistent vascular anomaly? We could, but I wouldn't expect the impingement to be in the area where it is here. What this animal had was actually an esophageal impaction because he was fed in acids. And if you look at what the esophagus is impacted with, it's impacted with a huge mass of interwoven fish bones. And it's interwoven fish bones because when you give a sea lion antacids, decreases the gastric acid as it should, but unfortunately sea lions need those gastric acids to digest fish bones. So this animal, his ulcers were healing up just fine, but he was unable to digest the fish bones that he was being fed, and we ended up with this esophageal lesion. Another condition to be aware of in cetaceans that's important, but not a big deal, is hepatic lipidosis. This is a young animal. This condition has been seen in a number of different animals and was recently described in Veterinary Path in a 2004 publication looking at lesions in cetaceans that stranded in the Canary Islands. If we take a look at that liver from one of my cases in cross-section, it's simple to see how expanded the liver is with fatty inclusions within the hepatocytes, normal fatty material stored within the liver of a young dolphin that became sick and inappetent. Similarly, what we're looking at here is just a different presentation of gastric ulcerations from a dolphin. What's important on this is we may not have nematodes sticking out of those ulcerated little craters, but nonetheless, these are areas of gastric ulceration. If we stick with gastric lesions, I think a fair lesion to show someone from a California sea lion and say what's going on is this one. And what we're looking at here is a tremendous number of stones within the stomach of a California sea lion. Now I don't have the gross photo from that animal, but I've got another animal, and you can appreciate that many times wild animals do a little bit of indiscriminate ingestion of things. And this is just a number of stones present within the stomach of an animal. There are a lot of theories as to why marine mammals may ingest stones and rocks, and they vary from everything that the animals are providing themselves with ballast to the animals are doing indiscriminate eating just because they don't feel right, and so they'll eat just about anything. And eating just about anything is not so good if you're a wild animal. Certainly, when we look at this picture of the stomach of a dolphin, you can appreciate that eating just about anything can be fatal. This is the stomach of a dolphin that died after ingestion of a tremendous numbers of plastic bags. Certainly, plastic bag, gastric, what would it be? Gastric stones, plasticolith. Here we have a dolphin plastic bagolith in the stomach of a dolphin, and unfortunately, these can prevent you from eating stuff like fish that you kind of should eat, and when that happens, you're not long for this world. So when these animals do consume foreign material and it forms expansive foreign body reaction in the stomach, here we can see this guy had a little medical interest. He's got what look to be those blue plastic gloves. It's not good for them in the long run. Sort of some other non-specific but important findings. Here we're looking at the peduncle of a dolphin. And you may look at these and say, what the heck are these? Somebody was trying to beat the heck out of this guy. Well, they may not have been trying to beat the heck out of this guy, but they may have been saying, hey, I want you to know your place in the social structure. These are rakes. And it's important to note rakes on the bodies of animals because there are a number of conditions that we've talked about earlier that can be associated with them. Remember, we talked about cetacean pox or tattoo. Oftentimes, areas where we have rakes are associated with the development of tattoo lesions. While I can't say for sure that these areas of changes in pigmentation here are tattoo lesions, that's the kind of things we often see. Tattoo will often follow rake marks. Remember, we also talked about erysipelathrix and inoculation, specifically of young animals, with the bacteria associated with rakes from older animals that have been consuming fish. They've got fish slime in their mouth. When that happens, they can inoculate the other animals as they rake them with their teeth. This is generally associated, again, with maintenance of social hierarchy. Dolphins can't pop each other with their flippers, so they tend to rake each other with their teeth. Now, this next slide doesn't fall nicely into any category, but it's a fantastic slide, and it was a great paper presentation. In 2004, Craig Harms presented the case of penile urolithiasis in a pygmy sperm whale. What's beautiful about this case is the story that goes with this lesion. If you look down here, just below the penis, you'll see this section of tissue here, and that was actually the tip of the penis. And according to Dr. Harms, when they were doing this animal's necropsy, they were sort of indiscriminately looking at things, and the tip of the penis inadvertently got cut and fell down, and they heard clunk. Well, being the good scientist that he is, Dr. Harms said, penises aren't supposed to make a noise like that when they fall. And then they opened up this area of the penis here, and you can see that he actually had an obstruction with struvite uroliths that just filled the penile urethra. I've never seen a case like this, but we do have trouble with struvite stones associated with a variety of cetacean species. These are kidneys from a dolphin, and what you can see here is multiple small struvite nephroliths within the small raniculi of the kidney. And we have both these miliary forms as well as these what would be staghorn forms if we were in a terrestrial animal, but what tend to be simply larger, simply larger nephroliths here within the kidney. These are important because they set up and are a good nidus for both bacterial infection, and they can be associated with essentially shutdown of these different sections of the kidney as they begin to damage more and more raniculi. Now, not every concretion in the urogenital tract of a cetacean is a stone. Here we've got a section of uterus from a common dolphin, and I think you can appreciate that here in the vagina we have a concretion, and if we look a little bit more closely at that, you can see that what we have here is what we call a vaginal concretion or vaginal calculi, and it's associated with incomplete absorption, likely of fetal bones. This is probably associated with incomplete expulsion or abortion, and what we have is just the final stages of maceration of a fetus. Remember, early on we talked about concerns with brucellosis in these species associated with vaginitis and metritis. It's possible, and we're looking into the possibility, that these may be associated with brucella infections, and although we get degeneration of the fetus, it takes a long time for these bones to degenerate and then get passed. Okay? Marine mammals, because of the nature of where they live, are unfortunately subjected to human interaction conditions. And let's take a look at a few of those because they are important and they're good to know about when you're working with marine mammal pathology. The first of these of quite significance is the impact of boat strike. And what I've got to demonstrate the impact of boat strike is a series of slides from manatees. Again, in the grand scheme of reading literature and important literature to know, there was a nice article in the Journal of Zoo and Wildlife Medicine in 2006 that talked about methods used during gross exam to look at watercraft damage. And what they did was they looked at both the spacing between these parallel lines, again this is where the propellers are sort of cutting the animals, as well as the depth of the lesions to identify the size of the propellers making these injuries. This is a very superficial wound. You can see that some of the wounds get deeper, and unfortunately some of the wounds are so significant as that the animals can be cut in half. I wish that propeller wounds only were significant in manatees. We see similar lesions in cetaceans. Sometimes we can even see them in large whales from large ship strikes. And certainly boat strikes are a significant cause of both morbidity and mortality in a number of marine species. In these chronic cases, here's the peduncle and sort of the paddle area of a manatee, and this animal has a chronic non-healing wound associated with essentially removal of his paddle. Let's move on and just take sort of a quick look at some line injuries in these guys. Line injuries are common, but unfortunately they can be fatal. And they can be fatal for a variety of reasons. This harbor seal, this is him the next day. He was alive the first day. The second day he is down and out simply because vascular structures were lacerated because of the presence of that line around his neck. We have cases where the line has transected the trachea. Unfortunately, we have some cases where the line has transected partially the esophagus, and in those cases, these animals have secondary conditions that can end up being fatal. I've got a shot here of the cervical vertebra from an animal that actually had gill net, which he grew into, and in the process caused chronic damage, not essentially a fracture, but a chronic malformed vertebral body, which secondarily impinged on the spinal cord. I'd like to move on quickly just so we can get a look at these last two conditions that I'd like you to know about. In 2005, a paper came out looking at acute and chronic gas bubble lesions in cetaceans from the United Kingdom. When I see a lesion like this, if I was doing comparative medicine, I'd think, do I have, a polycystic and biliary cystic condition? Well, this condition is very different than a polycystic condition in that we not only have these cavitating lesions, but we also have associated inflammation with these areas. The etiology has been proposed to be associated with decompression, and because when we're talking marine mammals it's something to know about, this is a lesion that I'd like you to be familiar with. There is a related lesion. This comes from Paul Jepson in the UK. Antonio Fernandez in the Canary Islands presented a different sort of condition associated with gas and fat embolic syndrome. This paper was in VetPath again in 2005, and they looked at some beak whales that they think were exposed to sonar. And what's important here is you need to be on the lookout for these kind of conditions and familiar with them, because gas bubble disease and fat and gas emboli are conditions of high interest because of concerns about sonar impactions on marine mammals. I hope that you feel comfortable at least with the comparative pathology as well as the special pathology of marine mammals. I hope that as you go through either looking at more cases of marine mammal disease, or as you begin investigating conditions of marine mammal or even exotic animal disease, you can relate what you know in terrestrial animals to the findings in animals that are a little bit more exotic. I hope you found these tapes helpful and interesting. Hi, I'm Dr. Judy St. Ledger. I'm a veterinary pathologist at SeaWorld, and I'd like to share with you today some gross photos of some diseases of fishes that I hope you'll find interesting. More importantly, I hope you find educational and informative to you as you consider looking at the pathology of fishes. Let's take a look at the slides. Now, a presentation like this isn't ever put together with the slides from one person. It really requires a lot of input from other exceptional individuals within the field. And just like these jellies, a lot of people came together to make things come together for this presentation for you today. What I'd like to do is to take a look at these conditions by the etiologic classification of diseases. So let's start with some of the bacterial diseases of fishes with important gross findings. I'd like to start out sort of with an up-close and personal look on the inside of a fish. And I'd like to do it because people say to me, oh, fish pathology is so different, I can't really relate to it. And I actually think that you can. And I think what's important is to realize that fish, just like mammals that you may know, have a limited spectrum of lesions for infectious diseases. Here what we're looking at is the liver and the spleen from a salmonid. And what we're looking at is the acute lesions of Eromonas septicemia. So Eromonas salmonicida has a number of different disease presentations, and one of them is acute septicemia. This is a major aquaculture pathogen, and it's a kind of pathogen that you should be familiar with and thinking about if you have salmonids that are demonstrating septicemic lesions. Now, what's important about this is that there's a bit of a classic lesion associated with Eromonas salmonicida infections. And the common name for this condition is furunculosis. Now, the cool thing about this is, in the word for the day sort of basis of life, furuncle can be your word for the day. These are furuncles. Looking at this slide, what we have here, and I apologize, I'm going to get that arrow eventually. What we have here are some areas where we have sort of almost cavitating lesions that are extending from the skin into the underlying musculature. A furuncle is a raised area of tissue that has sort of a soft center. So it's not a candy, it's a kind of a lesion that's associated with an Ehrmonis infection in fishes, specifically salmonids, so Ehrmonis salmonicida. Now, like many pathogens you know, Ehrmonis salmonicida doesn't simply stick with salmonids for its infection. The condition in koi or cyprinids is called goldfish ulcerative disease. And in these fish, ulcerations are common, and actually demonstration of the furuncles is much less common. Here's a better picture sort of looking along the side of a koi, and what you can appreciate here is we have multiple ulcerations with areas of peripheral red congestion and hemorrhage. This is a freshwater bacterial infection, and again, we see a number of different forms. The peracute or sudden death, the acute, where we see the multi-organ necrosis like we saw sort of in that first presentation, and the more chronic lesions where we have cutaneous ulceration with extensive cellulitis and associated myositis. In cyprinids, there actually is a commercial vaccine that's available, so there are ways to sort of deal with these infections. Now remember, when we're doing different pathogens in different fishes, we may get different names, but it's essentially the same disease. Take a look at the tail of this flounder. Well, this is a clever condition. This is flounder ulcer disease. And again, you can appreciate what we have here is the development of a small furuncle that will secondarily ulcerate and cause the ulcerative disease of Ehrmonis salmonicida in this flounder. Like with so many bacteria, Ehrmonis salmonicida has some brothers and cousins. And this is an Ehrmonis hydrophila infection. Again, another significant pathogen of freshwater fishes. These pathogens are actually part of the normal GI flora, and these infections are often induced by stress. So when we have things like changes in the water quality or changes in the stocking density or sort of changes that really cause stressful events in the lives of fishes, it's not uncommon to secondarily get lesions like this associated with the proliferation of these bacteria. This is a chronic disease really in some of these fishes, and we get ulceration and hemorrhage. Many of these lesions can secondarily become infected with protozoa. So whereas when we talk about mammals, we talk about primary viral conditions secondarily infected with bacteria, when we're thinking about fish, specifically cutaneous infections, it's the aquatic protozoa that commonly invade and cause leftover problems even when the primary etiologic agent is no longer present. An important thing to remember, and something we're going to talk about throughout this lecture, is the impact of water temperature, both on fish immunology as well as pathogen virulence. This condition is significantly impacted by water temperatures, and it's more common in spring and fall. Now, there are some conditions that have some pretty significant species specificity. This is a beautiful picture, and I love it because you could actually name the disease by looking at the picture. What we have here is areas of cutaneous hemorrhage and congestion associated with the areas of the head of the fish, or capital hemorrhage and congestion. This is a condition called enteric red mouth, and it doesn't take a rocket scientist to see the red mouth. This is an infection with Yersinia ruckeri, or yersiniosis, in a salmonid. Now, this is generally a freshwater condition, but we've actually seen yersiniosis impacting marine species as well. The condition has a variety of presentations, and it's often associated with skin and ocular hemorrhages. We can have the condition called pop-eye in fishes, and we'll look at that a little bit more closely later on. Rainbow trout in particular have a bit of a species sensitivity, and they are particularly sensitive to this infection. There are other salmonids, Atlantic salmon for example, that are much more resistant to infection with this organism. Now, one of my most memorable cases was a number of marine sharks where we saw sort of these ventral areas of cutaneous ulceration. And when I saw that, I thought, oh, that looks like a Vibrio infection in these animals. But when we looked inside, we noticed that these animals also had a peritonitis as well as multi-organ areas of hemorrhage and necrosis. And I was shocked when we actually cultured Yersinia ruckeri out of these infections as well. The point of the shark infection is not that yersiniosis is a primary pathogen in sharks, but that we need to do more than grossly examine these fishes to determine the cause of the pathogens, because sometimes we can be surprised. Now, do I think that yersiniosis is going to be an emerging developing condition in sharks? I truly don't. And in fact, I suspect there was something primary that sort of led for this unusual infection to develop in those species. I don't know what the primary condition was, but because I know about the pathogenicity of Yersinia, I know I should be looking for a primary pathogen with a secondary sort of unusual infection having occurred in those fishes. Now, just as in all animal species, there are some conditions that you simply need to know because they're so classic and so important. What we're looking at here is a catfish who's been opened up so that you can appreciate the fact that he's got acute necrotizing damage to multiple visceral organs. This is Edwardsiella ictaluri. This is the #1 economic disease of farmed catfish. And what's important about it is that this condition has both a marked seasonality as well as various forms of the disease that have really significantly different presentations that you should know about. The first one is a great one. When I talk about fishes, people often say, oh, you know, fish skin disease is all about white spots all over the fishes. And this is a condition where there's white spots all over the fishes. But this presentation of white spots is very different than the protozoal infections we'll talk about later. What we have here is a catfish that was exposed to Edwardsiella via oral ingestion. And what we find is that via the vascular system, you get areas of cutaneous necrosis multifocally throughout the skin. Those areas then heal. And I think if you look at this fish, you can appreciate we have some active sort of chronic ulcerations, as well as these healed, really sort of what we call milk spots or false spots present on the skin of this catfish. This is the chronic presentation of the acute disease of Edwardsiella in these fishes. So the acute or peracute condition results in these multifocal cutaneous pale spots or ulcerations in the skin. Now the chronic presentation of this disease is completely different. The chronic presentation is associated with the bacteria actually going up via the nasal organ and causing a meningoencephalitis. And what we have secondary to that meningoencephalitis is this area of necrosis of the frontal bone and ulceration of the overlying skin. This is a neat condition in that I'm very big on making sure you get cultures so that you've got corroborating information to support your pathologic diagnoses. In the first condition, if we want to culture the organism, you culture the kidney, the spleen, or the liver. In this condition, if you want to culture the organism, you need to culture the brain. So in the chronic condition of Edwardsiella in catfish, the organism is really sequestered within the CNS, but the lesion extends all the way from the brain through the frontal bone and literally removes the overlying skin. It's a very, very interesting condition. It is interesting in that water temperatures are important in sort of the seasonality of this condition. It's a spring and fall related condition, and again, it has to do with the water temperature. This is an important condition to know, and it's significant and very important, again, in farm catfish. Now, we started with bacterial infections because bacterial infections in fishes are important. We're going to move to salmonids now, away from catfish, and what we're looking at here are the kidneys of a salmonid. And to be honest, I don't know what kind of salmonid this was, but I don't need to, because looking at these kidneys, I can appreciate the granulomatous inflammation here. And if I see granulomatous condition in the kidneys of a salmonid, the first thing that comes to mind for me is bacterial kidney disease. Bacterial kidney disease is a bacterial infection caused by Renibacterium salmonellum. What's important about this is that this is a condition of both wild and farm salmon, and that pathogenicity again is related to water temperatures and stress. This is a condition of concern because we can have issues with hatchery and broodstock. And if we look at an adult fish impacted by this, you can see that sometimes you can have significant changes in a fish that's been ill for quite a period of time. He's got such expansion of his kidneys here that you can actually physically see the enlargement via the outside of the fish. Well, this guy's going to be perfect, unfortunately, for shedding the bacteria via vertical transmission, such that his fry can be impacted right from day one. Losses may not occur in these fishes until the fishes are adults. So it's important as we do hatchery management to make sure that we screen very diligently for this bacterial infection. In these adult fish, there's another sort of related lesion that oftentimes indicates, hey, there may be a concern with this, and that's a condition called spawning rash. Spawning rash is a cutaneous condition where they actually get these vesicles within their skin, and those vesicles can be associated at spawning time with infection with Renobacterium, the agent of bacterial kidney disease in salmonids. I've got this guy in here because of an interesting problem in eels in particular, moray eels in particular. This is an oral granuloma, and moray eels are a particularly susceptible species of fishes that have another granulomatous disease that you should know about, and that is a mycobacteriosis. This is Mycobacterium marinum in a moray eel, and what's important is the lesions can be highly variable. They can vary from these granulomas to a less distinct sort of area of cutaneous ulceration. Sorry, I'm having a tough time with this darn arrow, but I think you can easily appreciate here that this guy has both ulceration with development of a deeper draining tract, and again, that's associated with mycobacteriosis. There are a number of species that have issues with mycobacterial infections. Those include a variety of different eel species. Certainly in the home aquarist, we always worry, specifically in my world, of rainbow fish. But Mycobacterium can impact any fish species and should always be on the rule out for consideration with granulomatous disease. What we're looking at here is some yellow perch. And this picture came to me care of Paul Bowser. And I like the picture because I wanted a nice shot to demonstrate columnaris infections to you. Columnaris is a flexibacteria, and on histology or even wet mounts, it's nice because the bacteria form these haystacks, and it's the haystacks you're looking for. The organism is Flavobacterium columnare. Its name's changed 3 times since I've known the bug. But what's important is here we've got both these cutaneous areas of necrosis and ulceration, as well as multifocal areas of gill damage. And typically it's the gill damage I want you to think about, but the cutaneous issues are important as well because there's a specific lesion called saddleback where you can actually get sort of discoloration of the skin just caudal to the dorsal fin, again associated with this infection. One of the problems we have, like so many infections, is when we have the primary bacterial infection, we can end up with secondary fungal infections. And that's actually what happened to these fishes. They had primary gill damage from the columnaris disease, but then they got secondary fungal infections that were invasive into the areas of damaged gills. Columnaris is important because virulence is related both to water temperature and to water hardness. So it's a little bit funky in that water quality is a big issue in these conditions. Now, there are some other conditions that are a little bit funky, but that should make you think about columnaris. Here we're looking at a zebrafish. And the reason that I think everybody should love fish is, obviously fish are important for aquaculture, so they're a food item. They're important for display, so they're an important aquarium item. They're important for the fish hobbyist, so they're an important pet item. And now fish have really come of their own as an important lab animal species. Zebrafish are growing as laboratory animal species, and here we have a great expression of tail rot or peduncular disease, peduncle disease, that occurs in fishes in temperatures greater than 59 degrees, and it's important in these fishes. And tail rot can be very significant but sort of non-specific. So here we have it in a zebrafish, and as we look at other fishes, it can extend to where the tail is gone, or to where we actually have such extensive loss of the tail that you can actually see the bony rays of the tail that are there. Now, why do I show these different presentations of tail rot? Because in the small freshwater species, certainly I think of columnaris first, but again, there are a variety of pathogens, and you need to consider both is this a freshwater or saltwater fish, and what sort of changes am I seeing as you look sort of on the rule-out list for the variety of pathogens that can cause those kind of problems. There was an excellent paper in 2004 in the Journal of Fish Diseases that came out of Japan. And this is bacterial hemorrhagic septicemia in IU fishes. This is caused by Pseudomonas plecoglossocyta. I like that because it's a hard word to say, so given the fact that I can almost say it, I feel a little bit smart. But I've got this in here because, again, it's a species-specific condition with sort of a non-specific gross finding, but a significant one. If you look here, what we're looking at is the operculum have been removed, so you can see that the gills are both congested and necrotic. And it doesn't take any imagination at all to appreciate we've got ascites as well as acute liver necrosis and damage to multiple visceral organs. This condition is very significant in these cultured fish, and again, it's simply another bacteria to keep on the list of rule-outs, and a reason that we simply can't throw these fish in a pot of formalin and expect to have the full answer. Now I want to move on to sharks, because in aquarium, commercial aquarium, sharks are the best demonstrators of vibriosis I could ever find. There are a number of vibriosis infections, a number of different species of vibria that are important, but there are a number of marine pathogens that are good to know about. They include Aeromonas, Pseudomonas, Proteus, Citrobacter, and Vibrio. But what's important is in sharks, we get a variety of lesions associated with these infections. Here we have a sand tiger shark, and that animal was impacted with a bite wound on its tail, and you can appreciate that it's taking a long time to heal and the granular tissue to move in, and that's because we had a significant local Vibrio infection. Unfortunately in sharks, vibriosis isn't always just localized. We can get septicemia. Certainly here, with the expansion of the vascular size, you can easily appreciate the entire vascular pattern as it goes down the tail of these animals. In particular, we have issues with meningitis in sharks associated with Vibrio infections. So this is an important gram-negative infection associated with skin ulcerations, sometimes abdominal distension, and oftentimes causing both septicemia or specifically meningitis in shark species. But again, it's a common marine pathogen. It's more virulent when the animals are under environmental stress. Certainly water quality, as well as in the marine natural environment, pollution can impact these infections. I just want to take a look at another case of Vibrio. Here we have a ray, and what's important is this animal illustrates a need to know a little bit about normals. If you look at this liver, it's a big, well, if you could have looked at that liver, it's a big fatty liver, and that's absolutely normal. These animals don't have a swim bladder, and they use the lipids within their liver for buoyancy. Also normal is the presence of these abdominal pores, but completely abnormal is having fetid brown red fluid pouring out of your abdominal pores. Well, it's pouring out because this animal has a marked purulent abdominal effusion associated with an oophoritis and secondary peritonitis. Here's the animal's uterus, okay? Here's the animal's spiral valve, or essentially the shark's version of a colon, and what we've got is a bacterial infection secondary to an ovarian infection that was demonstrated as a peritonitis in this animal. Let's just take a quick look at some fungal diseases. This is actually a shot from Burning Man a number of years ago, but it shows how significant fish are to the lives of all sorts of people. This is a beautiful picture of saprolegnia. Saprolegnia is a water mold. It's a significant pathogen of catfish in the wintertime, but it can impact numerous fish species. As we talked about earlier, it's an opportunist, so it'll take advantage of any sort of damage associated with parasitic infections, bacterial infections, to really get in there and proliferate. The transmission is via zoospores that are essentially free-floating in the water, so they're highly motile. And it's good at colonizing the gills, ulcerated cutaneous lesions, things like that. The lesion in the gills is a mix, sort of an acute necrotizing bronchitis to areas of proliferation in lesions that are more long-standing with fusion of the secondary lamellae. And regardless of the nature of the lesion, with that much damage in your gills, you're going to have trouble breathing if you're a fish. Now, fish don't always like to be different. Here we have the head of a bonnethead shark, and you can appreciate that he's got a multifocal granulomatous dermatitis. This is a fusarium infection in a shark. And I've just got this in here to demonstrate that sometimes a lesion is just a lesion. Let's take a look at some viral diseases, and fish have many significant viral diseases. I've chosen just a few because they illustrate important points or they demonstrate changes that I really think you should know as you're looking at different fish conditions. Here we're looking at a fish, and this is not a fish trying to imitate Angelina Jolie. The whole front end of this fish is sort of distorted by this very significant proliferative lesion. This is lymphocystis. Lymphocystis impacts both fresh and saltwater fishes, and it's caused by an iridovirus. Now, it's an important infection because the cell that's impacted is generally the dermal fibroblast, but visceral fibroblasts can be impacted as well. It causes, as you can imagine, a significant hypertrophic proliferative change. We can see the nuclear enlargement. There are basophilic cytoplasmic inclusions in these guys. Sometimes there's inflammation, but there was an important comparative pathology paper, 2003, looking at systemic iridoviral infections, and I think it's a good one to take a look at if you're looking to learn more about this significant viral infection in fishes. Let's move on to what people tell me is sort of the dead red fish kind of classification of viruses. And I'd like to start with a dead red fish. This is a channel catfish who's been impacted by channel catfish virus. This is the #1 viral condition of channel catfish. And what we're looking at here, what we should be looking at here, is a number of ventral areas of red congestion and hemorrhage. Certainly you can get both focal to diffuse necrosis of a variety of organs. Hematopoietic and excretory organs are very significantly impacted, and this is a herpes viral infection. This is an interesting infection in that it has an age specificity, and like so many herpes viral infections, it is a condition of little kids. When you're a little kid in the fish world, you're a fry. So small fries and fingerlings in the summertime are the primary kids who are really vulnerable to this infection. Tends to be associated with warm water, and again, necrosis and edema are the real hallmarks of this infection. When we have sort of clinical presentation, it's kind of an erratic swimming within the fishes that are impacted by it. So erratic swimming in the summertime in small catfish fry, think about channel catfish virus. Here's a better picture of a little fry demonstrating ascites. And ascites in fishes is tough to demonstrate because as soon as you open them up, all that fluid seems to pour out of their abdominal cavity. When we see things like exophthalmos or Popeye in fishes, and it's kind of easy to see in this little kid, you can see that that eye looks like it's 3 times bigger than the poor little guy's head. Well, it looks like that because it's actually distended, and he's got what we call Popeye. When you see exophthalmos and ascites in catfish, think of this lesion. If you see similar problems in salmonids, it'd be good to think about bacterial kidney disease that we talked about earlier. Now, there's a growing interest in fish pathology specifically focused on cyprinids, so carp and goldfish. And what's important is there are 2 important infections in these guys that are often confused but need to be significantly differentiated. And what we're looking at here is the tail end of a goldfish, and you can appreciate what look like wax-like deposits here in the skin. This is carp pox, and this is caused by cyprinid herpes virus 1. Now, this is important because it's a cold water type infection, and it's really a cutaneous plaque. This is very much a lesion of epidermal hyperplasia and a self-limiting lesion. These lesions can come and go, and in the grand scheme of things, don't have significant clinical impact on the fishes. Let's compare that to koi herpes virus. Now, koi herpes virus is different matter altogether. What we're looking at here is significant acute necrosis and congestion of the gills, and this can result in marked mortality in these fishes, anywhere from 80 to 100% mortality in the impacted fishes. These guys get secondary bacterial infections, as we talked about earlier. This is a condition specifically of warm water, and what's important again is koi herpes virus, highly significant clinically, commonly fatal, unlike the previous case we just saw. When we're talking dead red, I like to go to the rhabdoviruses of fishes. And I like to go to the rhabdoviruses because there are a number of significant ones, and although the gross presentations are similar, looking at the fish that are impacted and sort of the conditions of that impact will tend to lean you one way or another to a different kind of virus. This shot is of infectious hematopoietic necrosis. It's a virus of salmonids. It's a major cause of salmonid death in freshwater. Specific salmonids that I think of are rainbow trout, sockeyes, Chinook salmon, things like that. This is a rhabdoviral infection, as I said, and what we see is acute necrosis and ascites, edema. It's an important condition because, again, it's a temperature-related condition, but mortality can be extensive, up to 100%. This is a condition where the virus is transmitted from either survivors to other fishes that they're exposed to or via the feed. So it's important, if feeding fish meal, to keep something like this in mind. When you're looking at these animals histologically, this is a nice condition because if we've got a salmonid with intranuclear or intracytoplasmic inclusions present within the pancreatic parenchyma, either the acinar or islet cells, this is probably the first viral infection I would think of. Now let's compare that a little bit with spring viremia of carp. The nice thing about fish diseases is they try to give you a name that gives you a little bit of a lead-in to what kind of fishes you should worry about. This animal, remember we talked about those pop eyes? He's got exophthalmia. You can't really appreciate areas of petechiae or hemorrhage, but you can when we look at sort of this grass carp. This is another rhabdovirus carpio. Again, it's a seasonal condition. It occurs in spring and fall. It can be transmitted by the carp louse. We'll talk a little bit more about lice and leeches later on. Mortality is high, and again, sort of non-specific findings, but one in particular that's kind of important when we see it in carp is petechia in the swim bladder. And when we see high mortality, spring and fall in carp species, if you've got swim bladder petechia, think about spring viremia in carp, okay? Now, I love this guy. This picture came to me, I think, from Gary Marty via Ron Hedrick. I didn't have one of these, but this is a significant condition for us on the West Coast. This is sardine viral hemorrhagic septicemia. So we know we've got sardines. We know that they've got red areas of necrosis, hemorrhage, and congestion in the skin, specifically of the ventral body wall, but literally anywhere on these fishes. This is another rhabdoviral infection. And this condition, like so many of these conditions, is associated with endothelial necrosis and then secondary hemorrhage. It's very similar to all the other sort of dead red grouping of fish viruses, but it's important because it's a recently identified, so it shows us that we're learning more about these viruses in fishes, and a significant condition in sardines, specifically off the west coast of the U.S. Neoplastic conditions in fishes are very significant, and they're significant because, remember, fish are excellent laboratory animal models, and when we're doing laboratory animal models, it's nice to have a fish species that both mimics conditions that we're interested in learning about and that can demonstrate carcinogenicity impacts. So it's a great idea to know about what's happening with specific fish neoplastic conditions. This was, when I first started learning about fish diseases, sort of the classic that everyone had to know about. This is a platyfish hybrid, and the way you can make melanomas in these fishes, and here's a melanoma here on the tail stalk of this fish is you take a platyfish and a swordtail. They're related but different species of fishes, and you interbreed them. You then take their offspring, so the F1 offspring, and breed them together. And when the hybrids, excuse me, I'm going to sneeze. Pardon me. When the hybrids, so the F1s have spotting, but the F2s, the interbred hybrids, tend to develop melanomas. And what's happened in those fish is they've lost some of the modifier genes that tend to restrict formation of tumors. So this was a wonderful way to demonstrate tumor generation via genetic modification. Well, genetic modifications come a little bit further, and the Zahn lab has now taken the zebrafish, and these are the leopard form of the zebrafish, and actually found ways to modify, again, genetic expression. And what we have in the areas where the stars are development of melanomas in zebrafish now as well. Again, sort of that was then, this is now kind of comparison. When I first learned about neoplastic condition in fishes, the classic lesion to know about was hepatic adenomas and adenocarcinomas in trout and salmonids. And the reason it was so important was because aflatoxicosis. We knew that in these species, hepatic adenomas were associated with aflatoxin B1, and that you could get development of hepatocellular carcinoma. What you're looking at here is a zebrafish with a hepatic adenoma. The tough thing is, This is a zebrafish with a hepatic adenocarcinoma. And I wish I had a good gross way to differentiate these, but in truth I really don't. To me, these look like we've got a pale fatty type area, and if you look in this area, we've got some hepatic tissue. That looks a little bit funky, but not terribly distorted. But under the microscope is where you're going to diagnose these cases. That's why zebrafish are so little. They fit very nicely onto a slide. So while gross diagnosis is important, certainly follow-up with histology is critical in these fishes. We still have interest with aflatoxin-associated carcinomas, but the classic conditions are now moving into sort of molecular science, such that the zebrafish are being the best models for hepatic carcinomas and adenomas. Jan Spitsbergen has done some very, very interesting work looking at these and looking at the impact of both environmental components as well as food components on both the expression and the development of these neoplastic conditions. And as time goes on, I think we're going to learn more and more about environmental impacts on different carcinogenicity conditions. I've got this guy in here just because I absolutely love this photo. This was given to me by Paul Bowser. Way back when the earth was cooling, I was in veterinary school, and angelfish were identified with this sort of Angelina Jolie lesion. But it's a fibropapilloma, and we actually thought that these guys, it was going to be the end of angelfish because of the development of this neoplastic lesion on the faces of the angelfish. In truth, it hasn't impacted the industry very much, so it's sort of relegated to the area of gee whiz tumors, but it's a good one to know because you will see this in the hobby fish still today. These are not just a little bitty gee whiz thing. This is a great gross presentation of walleye dermal sarcoma. This is an interesting neoplastic condition in that we see this condition more pronounced in the fall of the year. It is associated with changes in dermal fibroblasts, and in these masses you can see not only typical fibroblastic type changes that are typical for a sarcoma, but there's also laking of osteoid-like material that you can see within these tumors themselves. These nodules tend to be multifocal, and what's interesting about them is that they're associated with a type C retrovirus. Another retroviral condition of import is this fantastic lesion here in the abdomen of a salmon. If I can get this arrow to work, this is a salmon swim bladder sarcoma. Now the swim bladder is located in the retroperitoneal space, just below the vertebral column of these fishes. And if we could take that swim bladder out and fix it so you could get a better look, this is what you'd see. What we've got here within Atlantic salmon is an expansion of the swim bladder wall by this multinodular neoplastic sarcoma. And again, this condition is also associated with a retrovirus. How would you have an indication that this might be going on? Well, these fishes, obviously because they lose the normal functionality of their swim bladder, have a decrease in buoyancy. These neoplastic conditions can actually erode through the wall of the swim bladder, and you can have not only fish that sink, but fish that inappropriately float or float upside down because they no longer have air contained within their swim bladder. If it erodes into their coelom, these can be fishes with all sorts of interesting buoyancy issues. Just as a bit of a gee whiz, here we have a goldfish with an erythropheroma. And what's important to remember is fishes, like a lot of reptiles, have some unusual color-associated cells in their skin. So erythropheroma, chromatophoroma, just an interesting, neat neoplastic condition in a goldfish. Here we've got a salmon with a very impressive fibrosarcoma. And if you, take it back, fibroma. If you don't believe me, if we take him in cross-section, you can see that it extends from the muscle layer of this guy. Lastly, I want to talk a little bit about brown bullheads in the neoplastic area. And I want to talk about them simply because brown bullheads have a propensity to develop oral cutaneous papillomas. And this is important because these fish are commonly used as environmental assessors. And what's important is just to know that we see these papillomas, they have been described, and simply seeing them doesn't mean that the fish are in a hugely polluted environment, but it certainly does bode interesting for further investigations of the impact of pollutants on development of these neoplastic changes. Let's move on from neoplastic changes. You've had enough lumps and bumps, and let's take a look finally at white-spotted fishes. Now, this is Ichthyophorus multifilus, and because that's such a mouthful, let's just call it ICH. This is freshwater ick here in a catfish fry, and what you see across the body is white dots. It looks as though somebody powdered the fish. What's important when we're looking at these powdered fish is the fact that clinically these fish are irritated. They scratch on the bottom in a move called flashing. This is caused by ciliated parasites. It's the #1 condition of interest sort of when you get new fish for the home aquarist, but it's also a significant condition that's impacting hatchery fishes. Just last week, 250,000 trout in Idaho died of this parasitic condition, and the underlying problem was overcrowding. Overcrowding is common in hatchery conditions because when you have fry, you have lots of fry. So what's important is ick is a common freshwater condition, and it's a protozoal parasite. It's associated with a very limited sort of cutaneous dermatitis associated with the attachment sites of the organism. These fishes produce excessive mucus. Because the protozoa can also impact the gills, excessive mucus on the gills can impact the fish's ability to breathe. So this is a very significant infection. Marine species, not to be left out, have their own version of what we call marine ick, and this is a cryptocarian irritans infection. Now, interestingly, both marine and freshwater fishes have a rule-out disease called velvet disease, and it's called velvet because, again, the production of mucus in response to the parasitic dermatitis can cause sort of a velvety appearance to the surface of the fish. The way to diagnose this is either via wet mount or histopathology. Again, this is another holotrichid protozoa, causes epithelial hyperplasia and small erosions or ulcerations, but it's setting the fish up for secondary infections. It is impacting the fish such that it's irritated and doesn't want to eat, and it certainly can be a significant pathogenic condition in both freshwater and marine fishes. Now, there are a couple funky myxosporidians that are important, and this is Hennegaia. Hennegaia is a condition of freshwater fishes, and it generally is associated with gill infections. And what we see are formation of these xenomas, or big gill nodules associated with hyperplasia. It's also associated with cardiac lesions, and as with so many fish parasites, doing wet mounts or histologic evaluation is the way to do these diagnoses. Just a quick, I had to throw in one H&E, I couldn't help it, and it's because these xenomas are so beautiful. They are located both within and between the secondary lamella of the fish gills. So I promise that's my only H&E, but it was too beautiful to not show. I've got another classic sort of lesion. You can tell it's classic because we start with a black and white photo. This is a disease everyone should know, and it's whirling disease. It's a myxozoan infection with Myxobolus cerebralis. It's very significant to a variety of salmonids, and it has a 2-host life cycle. But what's nice about it is it has this great characteristic gross finding. The fish become bicolored. So if you look at these guys, these are little fry, and what you can appreciate is that their tails are darks and their bodies are light. And what happens is when we have infection in this area of the vertebral column, you get secondary discoloration of the tails of the fishes. And when the fish get bigger, you can actually have fry that look like this. So what's important is the organism Myxobolus cerebralis tends to like to grow within the cartilage, both the head cartilage as well as the vertebral cartilage of a variety of salmonids. It causes cartilage necrosis and then secondary discolored tails, spinal malformation. You saw sort of in that classic photo the bent shape to the body of that fish, and that it's caused by a myxozoan, and it's a common concern both of wild fishes and hatchery fishes. Now, if we take a look at zebrafish that are sort of bent, they've got their own problem, and it's associated with microsporidiosis. This is Pseudoloma neutrophilia, and Pseudoloma neutrophilia is a great disease of zebrafish because the name of the disease is skinny disease. And it's called skinny disease because when these fish are impacted, they become skinny. Now, you get development of xenomas in this condition too, but they tend to impact the hindbrain of the fishes and the spinal cord. And sort of the sporophorous vesicles containing the spores can be pretty significantly sized, and you find them in those areas. The lesion histologically involves both a significant myelitis and a myositis. And this is important again because zebrafish are of continued importance in the lab animal fields in the U.S. This is probably the best picture I have of a Glugia infection, and I think that's because many of the parasitic infections of fishes are very difficult to get good gross pictures of. What we see here are sort of these multiple cutaneous nodules here in the seahorse associated with the microsporidial infection of Glugia. Now, this is an obligate intracellular organism, and they tend to accumulate in these sporocysts. And what's interesting in the sporocysts is they become quite large and they form these xenomas again. Now, these are probably the best picture I have of the xenomas, but they really can be a problem because they have a direct life cycle. So when this guy should die, sometimes of the infection, as he sort of decomposes, he then can shed the organism and infect more of his tank mates. It impacts both fresh and saltwater fishes, and as I said, it is a common condition in seahorses. Now, I've got another condition here. Here we've got a fish, and I think off his chin, those are not unshaven whiskers, that's a Lernia infection. And Lernia is a crustacean, and it's a parasitic copepod. Like with so many fish parasites, it's important because it causes local areas of erosion and ulceration where it attaches, and when that happens, you've got a good area for secondary bacterial, fungal, even parasitic infections to jump in. Additionally, this worm, as with the next one we're about to see, can carry some infectious conditions such as viral infections. What we're looking at here on the back of this guy, that's not a spot, that's actually an argulus, known commonly as the fish louse. And this parasite can cause a fair number of secondary problems, and remember, it is the carrier of spring viremia of carp. This is a great parasitic condition, and it's a great parasitic condition because what we see here is a cataract within the eye of the salmonid. Whoop! I promise it's a cataract within the eye of that salmonid. It's caused by Diplostomum spathiceum. Diplostomum. And what's important is when you see cataract in fishes, there are a number of potential etiologies to think about. But when we have pond-raised fish, especially trout, it's important to look for these little flukes. And actually, if you look at this cataract, you can see small white flecks that likely are the flukes present within the cataractus lens itself. The way this parasite works is it has a 3-host cycle. Fish eating birds have it present within their small intestine. They then shed it, and that life form is picked up by snails. The snails shed the cercaria, and the cercaria actually get into the fish, likely via the skin. That will cause irritation of the skin. The fish will flash. They'll have local cutaneous ulcerations as the cercaria are going in and forming metacercaria, and then those go to the eye and cause either endophthalmitis or, as in this case, cataract development. It's a digenic trematode, and you can have multiple flukes within a single lens, and it leads to blindness. Well, why is that important? Trout are sight feeders, so they need to see what they're eating. And you can imagine if you can't see it, you're not going to eat well. It really significantly impacts production. So it's good to know about eye flukes. One more sort of common gee whiz type condition, but an important one to know about is nephrocalcinosis. And what I've got here is a picture of the kidneys from what we call a bony fish or a teleost fish. And the reason I've got a teleost fish here is now I'm going to show you the kidneys from a ray. So this is from a cow-nose ray. And a cow-nose ray, all rays indeed, are elasmobranchs or cartilaginous fishes. They tend to store their calcium not in their bones, but actually in their skin. Well, why am I showing you these two different fishes with these funky kidney lesions? Well, this is nephrocalcinosis. So what we have is significant mineral deposition within the renal parenchyma of both kinds of fishes. Now, both conditions need further evaluation, but here's what's funky about the rays. Not only do we have damage and essentially destruction of the renal parenchyma, but we can have metastatic calcification. So what you're looking at here is the heart of the ray. And here you can see this area is markedly sort of replaced by multifocal and coalescing areas of mineral deposits that obviously are significantly impacting the cardiac function in that animal. If anyone's looking for a great resident project. We'd really like to know more about this condition. We have tons and tons of samples, both clinical and postmortem. I'd really be delighted to have someone say, hey, I want to come solve the implications and significance of this condition as well as determine what the heck's causing it. Let's move on to a couple more miscellaneous issues. And I put this in because I think this is probably the best gross presentation of this condition I can show you. This is nitrate toxicity. Nitrate toxicity is methemoglobinemia, and it's not uncommon, unfortunately, in fishes that are kept in ponds. What we find is when we have cooler water, we have a decrease in the denitrifying bacteria. Now, the denitrifying bacteria are really important in the way that sort of the water quality handles levels of ammonia that are present in the water system. In addition, when the water becomes cooler, we have a decrease in the dissolved oxygen. So it's kind of a two-pronged attack or a double hit on these animals. When we have this, what we end up with is formation of methemoglobin and secondary mass fish kills or mass fish die-offs. I'd like the last condition that we look at sort of where I can show you pretty fishes with cool little lines and dots to be hole in the head and lateral line disease. Now, what I'd like to look at is this condition where we have ulceration and loss of different cutaneous cells that are associated with the special sensory cells of the fish's skin. So fish have a variety of different cells along lateral and capital canals. And these cells are associated with the fish knowing sort of where it is in space, as well as sensing what's going on around it. What's important is there's necrosis and general ulceration of these cells. And for a long time, people have been trying to figure out what's the etiology of this condition. We see it in both aquarium fishes, as well as even large marine fishes that are kept in indoor enclosures. It was originally thought, hey, we've got this solved. We find this protozoa, Spironucleus vortans, present in a lot of these conditions. But remember, protozoa are very good at secondarily invading conditions. This could be a nutritional condition. It could be associated with stress. It may actually be associated with exposure to natural sunshine or UV light. We don't have a good answer for this, but certainly the wounds can become extensive. And I think when we have these extensive wounds, what we're seeing is the primary problem and then secondary ulceration and again expansion via secondary invaders jumping in on these guys. I've got one last photo of zebrafish, and remember this histosection doesn't count because it's got a gross picture on the same slide with it. What we're looking at here is a zebrafish, and it's probably the best photo I think that is in existence of gas bubble disease in fishes. Completely different from what we talked about earlier with marine mammals. The way this condition occurs is that the fishes are living within supersaturated water. Now, the water can become supersaturated in a variety of different manners. It can be associated with faulty pumps. In other words, the pump is drawing in extra air as it's pumping water into the fish tank. And when that happens, it can cause too much dissolved oxygen to be present within the tank water. In cold water systems in particular, fast water systems going down raceways can really become agitated and take in too much air. And then if the water heats without proper off-gassing of the air, the fish, as they take it in via their gills, can literally take in supersaturated water, and then they have extra air within their system. This is essentially the fish version of the bends. What happens is these guys will, as the air goes through their system, it tends to fall out in the areas near the eye. And what we find, sorry about that, is that you get areas of both cavitation due to the air as well as hemorrhage secondary to the damage from the air that results in marked damage to these tissues. I want to leave you with some sort of one last gee whiz, and it's a gee whiz because it's an important case. What we're seeing here is a pink distension coming through the gill slits of this shark. And if you're presented with something like this, you have two potential rule-outs. And what's important is there's a pathologic condition, goiter. And we know a lot of sharks will have goiter associated with iodine deficiency. But there's a physiologic condition as well. And it is that many sharks can actually avert their stomachs. So this is actually not a goiter, but a stomach that is physiologically, a fish that is physiologically everting his stomach we think sort of in an attempt to clean out things that are sort of feeling funky in there or to reduce parasites in that area. The take-home message of this slide is you want to make sure that you consider all the options, because if you see this and you put this fish on iodine, you're not going to do a darn thing to help him. And in truth, he can take that stomach and put it back almost any time he wants. Now, there is a secondary pathologic possibility here in that many sharks can avert both their stomach and their spiral valve. Sometimes their tank mates aren't so friendly and they'll actually bite that. So we can end up with pathology from this normal physiologic condition. But if you know about it, you won't mistake it for something like a goiter ever. I'd like to stop there with looking at gross fish pathology lesions at this time. I hope you feel comfortable now when you see a fish to know that there are some conditions that are similar, but a lot of conditions that are different. But if you sort of look at the clinical history of the fish, the conditions in which the fish are kept and its water quality, as well as your findings, and then use ancillary diagnostics like bacteriology, virus isolation, and virus investigations, as well as histology to evaluate your cases, you'll do a good job and you can make a difference in fish pathology. Thanks very much for your time and attention, and I hope you found this lecture helpful.